I'm going to give you this.
Okay.
This says that I'll be sharing my abortion story today,
Okay.
and it also includes some of my constituents who couldn't make it.
Dr. Alden.
All right, good afternoon, everyone. Okay, if you are in here for 5:30, is anybody in here for Bill 530? We had some people confused, that's a homeschool bill. No, okay. The fire marshal, we have too many people in here. So if you do not have a seat, you will, and this is not me, if you do not have a seat, you will have to vacate the room. So I'm very sorry. But the officer, okay. All right, okay. Hang on. Okay. I am sorry that that is the way it is, but we are in the biggest room that we have. We have some sign-up sheets. Do we have sign-up sheets for that? Okay, we will have a sign-up sheet, but so that, people have other meetings, and so that we are not here all day long or into the evening, I'm going to do what they do in the House. Each of the presenters on the two abortion bills will have 20 minutes to present their bills. That's Jody Lott and Ed Setzler, Representative Setzler and Representative Lott. Then I will have 30 minutes of people for public comments and 30 minutes for people against. That would be it. So I would say to each side, choose the people that you want to speak very carefully so that you do not have people repeating the same message, and we can go forward. So just as soon as we can get going, we will get going. So if you do not have a seat, the fire marshals, and we will have to find a couple of seats for people that are employees of the, and are here for other bills also. Is there what? I don't know. Are there any of the other bills where they can hear the testimony or anything? Any kind of a hookup? I mean, I don't have any idea. Park. Representative Dreyer. Representative Dreyer. Representative Dreyer. Did you get all? Did you get your name far enough up? Okay, you're welcome. And I will give preference to the representatives that want to speak. I mean, that is only common courtesy to allow representatives that want to speak. Okay. We're trying to see if there is another room where they can somehow, plug into the testimony and all, so we can help. Okay. I mean, if you're waiting to sign up and you are about the 20th person on the line, you're going to be way too far down the line to sign up for 30 minutes. Yes, well, I don't know how I'm going to do that yet. Okay, can somebody tell people that are out in the hall, officers, can you tell them we're going to stream this into room 415? 415, if you can tell them. Okay. Okay. And if everybody will cut off their cell phones and all, since I just had mine ring, I will be cutting mine off also. How do I delete a message? Hit the more. Okay, sorry. Okay, everybody that's standing needs to leave the room. So we can get started. If you are standing without a seat, please leave the room. Yeah, it's being live streamed in 4:15. Live streamed in 4:15. Ladies, okay. Okay, so can you go pick up the sign-up sheet and see if it looks like it's way past 30 minutes? You want to speak on that one? Well, I'll have to ask. There's not one sign-up sheet. I'll ask if there's somebody speaking on Representative Tanner's bill. Are you going to get it? Okay. Okay. Representative, you may not get to speak if you're way down the list. We need to pick up the list now. Okay. Okay. Thank you. Come on, Demetrius. Can you get by? Okay. I am sorry for having to cut it off at a point, but we have to do that. Okay. And let me just say we have some other bills to hear first. I know that I don't have to say this. I know that everybody's going to act with decorum. In the legislature, we discuss very serious bills. And people on both sides of an issue have a right to be heard. And even if you disagree with them, they have a right to be heard with respect. So I don't expect for there to be clapping or cheering or anything else like this. We're going to run this meeting with decorum. These issues are not easy. They're not easy for my members on this committee, right? But somehow or other, we seem to manage down the road coming up with reasonable legislation. Sometimes, bills move. Sometimes they don't. Sometimes it takes a while to get the mixture right. But we have to hear, and we want to hear from constituents. But here again, we are one day from crossover. That's the last day that a bill can go over to the Senate or one can come from the Senate to the House. We are in a time crunch, and we can't go on for hours and hours. That's why I said for both sides to pick carefully who they wanted to speak for them. And I want to thank the police officers for helping take us stay in line with the fire marshal before they came and actually closed the meeting down because we have too many people. And to thank everybody here for abiding by my wishes to eliminate the people who are standing, and for my committee members that are here. Thank you very much. I'm going to call this meeting of the House Health and Human Services Committee to order. And Representative Tanner, I believe you're ready to go on House Bill 514.
Thank you, Madam Chair, and I will try to go as quickly as I can because I know you have a lot of other things to do. In front of you is House Bill 514. It's a substitute LC 337903S. This has been a collaboration of the House, the Lieutenant Governor's Office, and the Governor's Office to create a behavioral health reform and innovation commission. This commission would last for a period of 4 years. It would follow much like the Criminal Justice Reform Commission did in taking a very deep dive into a very difficult subject with a group of experts from across Georgia, from a wide variety of expertise dealing with behavioral health, from providers to psychiatrists to education professionals to the law enforcement community and others. It would also have 2 members of the House and 2 members of the Senate, and the governor would appoint the chair of this commission. Again, and a lot of their work would be done very similar to the Criminal Justice Reform Commission in subcommittees. Some of those subcommittees are listed It also gives the authority to the chair to be able to add some additional subcommittees if they feel like it's necessary when they get into the work. One of the things that's also in the legislation is that the agenda for this commission, as long as we're under the settlement agreement with justice and behavioral health, the agendas would have to be approved by the governor's executive council to make sure we were not doing anything that would hinder that settlement agreement. So, Madam Chair, I'll be happy to answer any questions. I'm not sure that there's a reason to read down through every member of the commission, but again, appreciate the all that's been done by the Department of Behavioral Health over the last decade to make great strides in this area, and look forward to this group of experts continuing to work in this area to continue to make more improvements. And Madam Chair, I'll be glad to answer any questions.
Okay. Questions from the committee for Chairman Tanner? Okay. Okay, Representative Barr. There you are.
Thank you, ma'am. Quick question, simple question. What was the thought process on the end date of 2023?
The idea was that it would go for 4 years after it was established. That it would take a lengthy time. This is a very complicated topic with a lot of different areas of discussion, and the General Assembly could always come back and extend that. Originally, there was some consideration by doing this by executive order from the governor, much like criminal justice reform was initiated in the beginning, but then was decided to do it legislatively. But we could extend that date if it was necessary in the future.
Very good. I look forward to this one. Thank you, sir.
Thank you.
Okay, Representative Hutchins.
Thank you.
Hutchins' son.
Thank you, Chair. I just had a question. Will this hinder anything that's proposed to move forward, like the APEX program or the $8.4 million going into the budget this year?
It definitely wouldn't interfere with anything in the budget, and it doesn't interfere with anything that's being done at the Department of Behavioral Health. As far as any legislation now or in the future, then that would be, of course, up to the members of the General Assembly and the governor's office how they chose to move bills forward. But this does not in any way stop any action from happening, no.
Okay. I like it. Thanks.
Thank you.
Okay, other questions? Okay, is there anyone, okay, we got one. Oh, Representative Dempsey.
Yeah. Chairman Tanner, I want to thank you for your work. I know you've worked real hard on this. I've not been a part of it. And I just want to make sure and make clear that nothing will happen until the justice settlement is actually settled, because that is such a fragile document that we have no control over, actually.
It's my understanding from the way the governor's office added language in that any agenda for any meeting submitted prior to the settlement agreement would have to be approved by the governor's executive council.
So there's not any date certain necessarily of when you're trying. I know it says, as I read it, I think that you plan to meet at least 2 times a year, or whoever. I don't mean to assume that it's you, but
that's
it's
right.
a commission, because often there are commissions that take place and that we help with and that we're never even
Correct, that's right.
part of later, just like study committees. But I just want to make that a very important part of this conversation, and that while all of these entities are so important to the whole umbrella of mental health, that the real focus of this, I hope, will be on those who struggle with true mental health and addiction, the families that are genuinely affected by it, because the health part of mental health is the root cause of what we really need to deal with. So I just want to ask you to please make that your focus.
That's correct. I can tell you some personal stories about my personal interactions with family members and others who have been lost by suffering from mental illness. So I know all too well how it affects families. But again, it doesn't prohibit the committee or commission from meeting prior to that, but it does require that the governor approve the agenda, again, to make sure, because the governor's council will be involved in the conversations going on behind the scenes with his commissioner of the Department of Behavioral Health, to make sure that this commission's not doing anything that, in his opinion, would hamper the progress of the settlement agreement. Yes,
Well, I
ma'am.
think it would be fair to say, too, that there probably is not a member in the House or the Senate that do not hear from people whose lives, as you say, are touched by this, whether it's their own family or just constituents that let us know. It is a huge challenge, and I hope we can act with care and caution and not move fast.
Thank you.
Okay. Thank you, Representative Dempsey. I know of your passion for people suffering with behavioral disorders and illness. Did you have an amendment or anything, or just?
I just have great concern about it, and of anything that's sort of done this quickly. I mean, we're in that window of time right now when a lot of things are moving fast, and as members, I think we have a huge responsibility to be careful.
Thank you. Do we have anybody else? Okay, we have no other from our members. Do we have people in the audience that want to speak on this issue? Is there somebody from the community service boards? Okay, will you identify yourself and
Thank you.
be brief?
Yes, very brief. Thank you, Madam Chair, members of the committee. We're just grateful to be here today to help support what Representative Tanner is putting forth, and also want to extend gratitude. I've met with Representative Tanner twice to talk about House Bill 514, and want to just say that your community service boards are funded for a very, very important population. Sometimes I think we forget the specifics of that population. When we look at the prevalence and the population that we serve, it is a small percentage of individuals, Georgians, with mental illness, substance abuse, behavioral health conditions. And we are absolutely supportive of any type of reform which increases access and greater comprehensive services for individuals with behavioral health disorders. We see our General Assembly, our members of our General Assembly, as key strategic partners in this. We see other providers as key strategic partners. And we just ask that as we go forward and look at this, that we think about some of the innovation that is actually happening currently, and that represents our communities and the needs in our communities. So we really would like to engage, and as we see you as strategic partners, we also hope that you view us as strategic partners as this bill and reform about the behavioral health system in Georgia starts to take shape. Thank you for your time. I want to be very respectful of everything that you've got on your agenda today.
Wait a minute. Okay, and you were with who? With whom?
I am Melanie Dallas. I'm the CEO for Highland Rivers Health. We are the community service board that is in Northwest Georgia. We serve 11 counties. We have about 18,000 individuals that we serve annually up there.
Okay. Representative Tanner, is this the version that I gave you yesterday?
The one that I'm reading from is the version that you gave me yesterday.
Okay.
It's the one that,
Where did we put the other people on it?
because the original one only had 21, this one has 23, so this is the one you changed.
Okay, wait a minute. Okay. Okay. I can't, I think we're missing a page.
It has, number 45 has a representative from the Urban Community Service Board, and 46 has a representative from
Okay.
a Rural Community Service
All
Board.
right, we're missing a page. We're missing a page on this, that's why I couldn't find it. All right?
Yeah.
Okay,
Mine's 5 pages. I may have the full copy.
we're
Okay.
missing a page.
You want
Okay, this is what happens when we're down to the last wire and things happen in a hurry. Pardon? No, it's missing a page. Okay, here, okay. Okay, hold on just a second. Okay, if you're finished, and who are you with?
I'm with Highland Rivers Health. I'm one of the CSBs in Northwest Georgia, and I'm happy to answer any questions if there are any.
Is there any questions for the presenter? No. Okay, what we're gonna do is, Representative Tanner, we're gonna get the copies, like, so the members can see them. You can go. I'll call for a vote,
Okay.
all right?
Thank
And-
you.
And at a later time, so we'll get copies for everybody. And we can look at that page. I'll tell you what's on the back. I mean, one of the main thing on the page is it listed out who would be the members on the commission and, you know, who's going to be on that commission. So I think you need to see it before we vote on it. And I apologize for the thing. We have legislative council has worked themselves to death, getting out last-minute substitutes for bills. And so I appreciate what's going on. Yeah. Mm. Okay, all right. So we'll put that one on hold. And I would ask the committee to just let me make that as a chair decision without having to say we have to put it on the table and move it back out again. All right, let's go. Representative Dempsey, House Bill 578. Would you please check how many pages are we supposed to have? Let's make sure we. So I have 7 on mine, is that correct?
That is correct. It is.
Great, and it's LC 289312ER?
That's right.
Okay, go ahead.
That is so right. This is a bill that came in, and I apologize, it did come in very last minute, but it deals with a very important measure. I'm going to try to stay back from it because I can hear it vibrating. So this deals with a challenge that the Department of Human Services is facing, that contractors who receive conviction data on volunteer students, interns, needs to be used. And right now, they are not able to do that. Currently, the statute allows for fingerprint-based background checks of final selectees for employment for the Department of Human Services. So those who handle our elder care, DFACs, many of the issues that are private, and that we need to make sure that those who see any records actually do not have a criminal background at all. So those who provide direct care treatment and custodial responsibility or any combination of those issues. The statute's not been updated to keep pace with the department's need to ensure that anyone working on those services has actually got a clean criminal background check. So this will allow them to fully vet through fingerprinting-based background checks and make sure that we have appropriate people looking out for those who are some of our most fragile Georgians.
What have we got? Representative Petrie. Where are
Yeah,
you?
thank you, Madam
You
Chair. I'm down here.
are. Okay.
And thank you, Chairman Dempsey. Just a quick question. So this would, this bill would hold volunteers, interns, students, et cetera, to the same standards we did in Senate Bill 406 last year with fingerprinting requirements?
I'm not
Is-
sure about
is that true?
406, the numbers
The
right now at this
fingerprinting
point are-
bill we had
Right,
last year, would it
right.
be, would this be consistent with that?
It follows that everyone who had access to any of those records or actually delivering services is fully vetted, and we are sure of that, not just an employee.
Gotcha. Thank you.
Okay.
And it has come as a request from the department.
Other questions from the committee? Okay. Representative Demetrius. Number 6? Push your button. Okay, you want to go to 5? Okay.
Thank you, Madam Chair. Madam Chairwoman, I love this bill, resolution. I have one little small question. With the people that's already there in the facilities, I know this is for new hires. Would the same thing apply to the people that's already working in that capacity right now?
So right now, the statute allows for fingerprint-based background checks on final selectees of employment. So they are under that right now. It is,
Okay.
it is making sure that sort of those auxiliary employees that are there are also fully vetted.
Okay, thank you. At the appropriate time, Madam Chair?
Okay, at the appropriate time? Okay, we have representatives from the department. Would y'all like to? Okay, so the department is in favor of the bill? Okay. Any other questions from the committee? Anyone else that's here that wanted to speak on this bill? Okay, all right, then what is the committee's pleasure? Wait a minute. Representative Demetrius, sorry. Douglas, I call you Demetrius all the time, and I apologize. Representative Douglas, you ready?
Do pass on House Resolution 421.
We have a due pass and a second. Any other discussion? All right, everyone in favor of the passage of House Bill 578, say aye. Aye. Anyone opposed, no. Ayes have it, Representative
Thank
Dempsey.
you.
Okay,
Thank
you have
you.
another bill?
I do. I have a House resolution to put forward a joint study committee. This is House Resolution 421. As we look at so much on mental health, and I know that this committee is so engaged and cares so much about it, one of the particular areas that we have not really focused on is that very beginning, the intervention point that we really need to focus on to deal with the realities of some of the effects that come from not catching an issue early. So this is a joint study committee focused on infant and toddler social and emotional health. It is laid out very clearly in here, recognizing, and I've had several members ask me as this began to sort of bubble up, what can you do with an infant or toddler? Well, there is a lot. There's fetal alcohol syndrome that we know will probably produce effects later. There's early intervention now in the realm of autism and on the spectrum on eye movement and lack thereof to follow. There are a lot of windows to look into and to try to diagnose early and to try to help those children have the best opportunities later in life. There are also the issues of maternal health that come into play. If you do not have a healthy mother, it's very hard for that mom who is perhaps out of balance and not being treated for that to not really provide the best environment for the child to begin its early life experiences. So those are some of the issues I think to look at. It will be a joint House and Study Committee. It lays out very clearly, if you start looking at line 37, talks about 3 members of the House, 3 from the Senate, a representative from Behavioral Health and Developmental Disabilities, Department of Early Care and Learning, Department of Public Health, Voices for Georgia's Children, and GEARS, Georgia's Early Education Alliance for Ready Students, as well as 1 representative from the Georgia chapter of the American Academy of Pediatrics. So it is dealing with that earliest, most important window of time. And I would ask for y'all, if there are any questions, of course I want to take them, but I would ask for your support. This is a great opportunity I think we have.
Representative Newton.
Thank you, Chairman. I really appreciate you bringing this. I know the previous governor and first lady worked hard on that 3rd grade reading and realizing that was a key predictor in success in both in high school and beyond, career academy or wherever. I appreciate you bringing that back to the infants that are in our care, learning. We're even talking about reading and all the different studies that are coming out, realizing how crucial that is. But I really appreciate you bringing this bill and look forward to supporting it.
Are there other questions for the chairman? Chairman Dempsey. Okay. Is there anybody in the audience that wants to speak on this bill? All right, seeing no one, what is the will of the committee? So moved. Okay, I have a motion to move. Do I have a second? Second. A motion is second. Is there any further discussion? Okay, hearing no further discussion. Everybody in the favor of the passage of House Resolution 421, say aye. Aye. Everyone opposed, no. And Representative Dempsey, I hope we got to you quick enough. I know you have other meetings, and did we make it quick enough for you to hit the other meetings? Okay, thank you. All right. We're waiting on Representative Tanner's, okay. Well, we will move on that when we get it. Okay, Representative Sessler, let's move on. You have 20 minutes. And who's keeping time? I hate that you only have 20 minutes, but, because I know you're passionate about this issue, but this time I'll have to ask you to be succinct.
Ladies and gentlemen of the committee, it's an honor to come before you today. This is an important matter, and that's why we bring it before you.
And it is House Bill, and what are we working off of?
We're working off House Bill 481. There's a committee substitute, LC 411938 ERS. 411938 ERS.
Okay.
I'll highlight the differences in the substitute and the original bill. And Madam Chair, the original bill was my policy objective. I think the substitute is being offered at the request of others that care about this issue deeply and want us to get to a consensus so we can move on this.
Well, I know there's been a little confusion. So this is your bill, and the one that Representative Lott is going to present is the governor's bill, correct? That's my understanding.
We have moved forward with this language and with the bill. Our governor is supportive of the concept, and I don't want to speak for him, but this was one of the reasons it's HB 481 is we were waiting for consensus language that the governor was comfortable with. So I know we have support from
Okay,
him
but
on
this
proposition.
is your bill to start with.
Yes, thank you.
Okay,
That's why I'm
and-
the head sponsor. Thank you, ma'am.
Okay.
Madam Chair, members of the committee, again, it's an honor to come before you today with HB 481. I want to say before we start this, this is a proposition that I believe we all understand is very important. And it's a bill that is medically sound, legally sound, and from the perspective of common sense Georgians, something I think we can coalesce around and strongly support. On a Wednesday afternoon in March of 1970, a 20-year-old mother, single college student here in Atlanta, gave birth to a young child in eyeshot of where we're sitting at Grady Hospital. In March 18th of 1970, that 20-year-old single mom was under a circumstance where abortion wasn't free and easy like it is today. And it was no less serious of an issue then than it is now. It's a timeless issue. As we go back into the ancient times, we see this issue of abortion was something that medically was unacceptable, even outside of the Christian world. And that young mother, as she gave birth to me, as a 20-year-old single mom, laid the groundwork for my understanding of this issue, and something that I've never been able to forget. Because on that Wednesday afternoon when I was born at Grady Hospital about a mile from here, that 20-year-old college student from here in Atlanta, 7 days later, on March 25th, 1970, another mother, married, but in financial difficulties, went into Grady Hospital to pursue an abortion and led to the series of circumstances which led to the Doe v. Bolton case. That was the plaintiff in the Doe v. Bolton case, 7 days after I was born. Same hospital, Grady Hospital, a mile from where we're sitting. This is deeply personal to me, as I know as it is to many of you. We know that the Roe v. Wade decision, which also came in 1973, came out of Texas, but the Doe v. Bolton decision came out of Grady Hospital, less than a mile of where we're sitting right now. Those two cases together set in action a series of events that led to the structure we have today and have had over the last 46 years with respect to how abortion is treated in this nation. I bring this to you with great humility because this is serious policy and it's something I think we need to talk about. And I'm proposing HB 481 because it's deeply important to Georgians. I bring it to you today because I believe it's medically sound, I believe it's legally sound, and I believe from the common sense of Georgians, they recognize that science tells us that a living, distinct, whole human being in the womb with a heartbeat is worthy of protection. We can debate matters of many things in this legislature. Many of us share different governing philosophies for the size, scope, and scale of government in American life. But one thing this General Assembly recognizes is that human life is precious. Human life is deeply precious. And that a child with a beating heart inside their mother is worthy of full legal protections. That's what this bill does. Let's walk through this, and if I could please the chair and members of the committee, I'm going to walk through the bill. I do want to talk through a couple things to outline to you how this is medically sound and legally sound. And I believe from a moral and common sense perspective sound. That's why I bring it to you. This isn't about politics. This does nothing for me politically. It's not pushed on me by any organization. It's something I've wanted to do for 13 years. But I believe now is the time. We see other states have taken a stance that human beings' lives can be torn asunder from their mothers at 38, 39, 40 weeks of gestation age right before they're born. I think the American people were woken up by that and recognize life in the womb is sacred and worthy of full legal protections. What this does is it draws the line that when there's a beating heart, when there's a human heartbeat inside of a mother, that's a human being that's worthy of protection. And that is the privacy interest of the mother, which we recognize and respect, and the life interest of the child. As those two things interact, this life interest that we know begins at conception, and this privacy interest of the mother, as those two things intersect, let's please come to consensus in HB 481 that as those two, is the privacy interest of the mother and the life interest of the child, as they intersect, let's please come to consensus that the point of a viable pregnancy, the human heartbeat, is a point we can all agree, people of both parties, life is worthy of protection. Madam Chair, members of the committee, if I could point you to section 1.2, page 2 of the substitute. We have 3 pages of legislative findings, because this is not something that's been unconsidered. There's been work with a number of people who understand very deeply legally and medically the significance of this. And we recognize that what we're talking about here is 14th Amendment protection, equal protections under the law for living, distinct, and whole human beings in the womb. We recognize that as the 14th Amendment was passed in 1868, it was passed for one reason. It was passed to give equal protections under the law to entire classes of persons who've never been recognized as people. The 14th Amendment was passed in 1868 to give full legal recognition to entire classes of persons that had never been given full legal recognition. That's exactly what we're doing here. There's an entire class of people. We know that from the point of a beating heart, you have a living, distinct, and whole human being in the womb that's worthy of full legal protection. So we're walking in the tradition that was set forth in the 14th Amendment when it was passed over 150 years ago. As we walk through this, you can see that we recognize that children in the womb are living and distinct. They have their own blood types. They have their own DNA. They have their own organ systems, fingerprints, and unique genetic characteristics unique from their parents. We also know that, as you see down in subsection 5, Pruneyard v. Robbins, a California case from 1980, recognizes that when states act to expand fundamental rights more generously than the federal government requires, the minimum standard, those are recognized. You know, if you think back to the same-sex marriage debate, the state of Massachusetts recognized the franchise of marriage more expansively in Massachusetts than the minimum requirement of federal law. And the federal law said, okay, we're going to allow Massachusetts to recognize the franchise of marriage more expansively than a minimum standard required of federal law. This is walking that same tradition. We as a state recognize Fourth Amendment privacy more expansively than the minimum standards required under federal law. The Fourth Amendment rights against unreasonable search and seizure in Georgia is more expansive, it recognizes one's privacy against search and seizure more expansively than federal law requires. We do that as states. What this bill is doing is recognizing the life interest of the child, recognizing the humanity of the child in the womb as a human being more expansive than the minimum standard that the federal government mandates us to do. And we find this case, Pruneyard v. Robbins of California, as you study the case, the same thing happened. There's a federal court case that says Californians don't have this right naturally. The legislature acted, and then after that legislative action, the U.S. Supreme Court recognized, okay, now this interest that California has affirmed by law is now recognized, and because it's more expansive than the requirement of federal law, and it was recognized in a very, very similar and interesting parallel case. I laid that out here on page 1. I'm not going to spend too much time in these legislative findings, but I do want to highlight that the American College of Obstetrics and Gynecology recognizes there's one threshold for the standard of a viable pregnancy. The key threshold for viability of pregnancy, there's some others, but the key threshold is the presence of a heartbeat. You have a viable pregnancy when a heartbeat is present. So we see medically that the threshold for viability is pregnancy. We see under the Uniform Determination of Death Act, a 40-year-old law that applies in almost all the states, the standard for when someone's life is over is they don't have a heartbeat, they don't have brain activity, and they have no respiratory activity. If any one of those three exists without life support, the person's alive. So throughout life, we recognize if there's the presence of a heartbeat, medically, the person's alive. They're not dead. Why wouldn't we apply that in the womb? Of course we would. Common sense tells us that we should, and that's what HB 481 does.
Representative, you have a little less than 10 minutes left.
Thank you,
I
Madam Chair. Appreciate
want you
that.
to walk through the bill since this is a substitute
Yep.
that I got less than an hour before this meeting.
I'll highlight the 6 or 7 lines that are different, Madam Chair. I'll
Okay.
be glad to do
no,
that.
I mean,
Thank you.
You need to walk it through with what
So-
the bill does.
So, as we lay that groundwork medically and legally, we recognize this is sound proposition. Ladies and gentlemen, if I could have you draw your attention to line or page 5 of the bill. The bill doesn't make that many changes to the structure of our existing abortion law. One thing that it does do is we recognize the humanity of the child in the womb. We recognize that there's certain practical considerations we want to take into account. Many things that we do as a state with respect to population counts track against the United States Census standards. They're promulgated and pushed, and they're subject to federal law. Our elections and all those kind of things, all the population that drives all those things are all driven by the United States Census Bureau. But there are some state formulas, though, that we maintain. And we recognize through a few of our agencies, we can have the discussion about some of the details. There are statewide population counts that we do that are not subject to census data. For example, the disproportionate share of hospitals, the head counts that apply through our Indigent Care Trust Fund, there's a head count that applies that's state specific. It's not purely tied to census data. What this allows you to do is it recognizes that the state, in making some determinations about how we count head people, you think about the unborn children are part of the medical system. It allows us, it may only have a 0.5% or less than 1% impact on those numbers, but this is permissive to allows the state to take children in the womb into account in these kind of statewide population counts. Practical matter, simple matter, doesn't cost us dollars, but it also recognizes the value of the child. Madam Chair, the operative part of this bill, aside from those administrative portions, lines 151 through 166. 151 through 163 don't change at all. It simply provides that no abortions are authorized or shall be performed unless on an unborn child unless there's if the presence of a human heartbeat's been determined. For members who are new to the legislature, one thing we try to provide very broad berth to the medical profession here in the state. This bill does not prescribe a medical standard of care. This does not tell doctors what kind of ultrasound they would use to make these determinations. Doesn't distinguish between Doppler ultrasound or transabdominal. We don't get in because doctors are trusted to operate within their standard of care to make these determinations. But it does say, if there's a detectable heartbeat, the child has a beating heart, you can't take the child's life through abortion. The rest of it is handed over to the doctor to be able to manage within this medical standard of care. We don't try to dictate doctors' operations from the legislature, and I would never try to put that into a bill. So if there's questions about details, as we walk through this, the medical standard of care defines these things, and I think we do well to trust our doctors to do that. Madam Chair, one change I'll highlight to members, lines 164 through 166. While I recognize all life is precious, and that the manner of conception has nothing to do with the value of a human life. The manner of conception has nothing to do with the value of human life. I had a number of members come to me and say, Representative Sessler, this is important. This is an important matter. We need to act on this year, and move on this legislatively. And they came to me and they asked for this exception that in essence provides an exception. If the child is conceived of rape or incest, that an abortion wouldn't be prohibited starting at human heartbeat. I have misgivings about that in many ways because I believe those children are just as innocent as others that are conceived intentionally. I was an unplanned pregnancy. I'm not here because my parents planned to have me here. All children have the same value. But as a matter of members coming to me and saying, let's get a consensus bill that we can get bipartisan support perhaps in this chamber, I added lines 164 through 166 to this bill because some people believe, members are informed, they believe that rape's an important exception to have in this. from heartbeat to our current standard of 20 weeks. Madam Chair, really, as you look through the bill, everything's really just cleanup language through page 8. It's just inserting human heartbeat next to the provisions that deal with informed consent for mothers, where doctors talk about, the gestational age. Operatively, the only piece that is operative after that is down on lines 289 through 291. Again, the exact same language that was in the original version. And it says that if a child is killed through a wrongful death action, today, at about 15 weeks, what's called quickening, if the mother can feel the child, after that point, the full value of the life of the child could be brought in a wrongful death suit. In this case, it takes it back to the heartbeat. Again, so our abortion law is consistent with our civil law. It all lines up. It's all consistent. And I think that's important to have that level of consistency. The last thing we provide, Madam Chair, on lines 298 through 300 is something that many members brought to me. In fact, some prominent leaders in our capital asked me to include. It simply says that from the perspective of our tax code, that if we recognize the humanity of the child in the womb, if mom and dad are pregnant with their first child on December 31st, 2018, that instead of having 2 family members for their taxes, they have 3. And in our tax code, that recognizes the child, not just theoretically, this bill's not just about abortion. This bill's about recognizing the humanity of the child. And that we recognize that when people are painting rooms, getting ready for children, and incurring costs, maybe mom's on bed rest because she's pregnant, there's a simple provision here that I think is common sense that we can all get behind, that if mom and dad are pregnant, that child should be recognized that way in their taxes. Very simple proposition that some leaders in the Capitol brought to me, and I think it's appropriate to bring before you, Madam Chair. And then, of course, the last change is just the effective date of January 1st. Some folks in the departments wanted more time to implement this and make sure that everyone's online before it's implemented, so I moved it from July 1st, 2019 to January 1st, 2020. Be glad to answer questions, Madam Chair.
It's remaining if either.
Dr. Kathy Altman is a physician. She's going to speak in the time allocated for speakers. I just wanted her here in case there were some questions. Of course, Ms. Jane Robbins, attorney, Harvard-educated attorney, has been involved with us in the process, and appreciate her presence in case there's some questions.
Okay, so you're ready for questions?
Yes, ma'am.
Okay. You made it at about 18 minutes, Representative.
What's that?
You made it at about 18 minutes. That's a lot shorter than Judiciary non-civil subcommittee meetings.
I will forgive the chair if you say that's uncharacteristic of me.
All right, it's uncharacteristic. Thank you for staying in line. Okay, we do have questions. Representative Mitchell. Pick your best question.
Yeah, Chairman Sessler, my good friend, I appreciate your serenity and seriousness that you take this with. We've had many discussions about this. Just a quick question or two, if I may, and that is line 164 through 166. That wasn't based on any science that you put that in there. That's a political consideration that we have there. That's no fault of the what, as you called it, the unborn child there, but we made a political consideration.
No, I wouldn't say that.
You would say?
Thank you to my friend. We've been close since I came down here 14 years ago. We recognize the children in the womb are living distinct and whole from conception, and their manner of conception has nothing to do with their innocence and their right to life. I think it's so important that we act on this. It's so important that we protect children that have heartbeats. We know they're part of the human community. I think common sense tells us that. Medical science tells us that. That as people came to me and said, the emotional complexity, the difficulty of this rape question makes it very difficult for me to support this, even though I know it's so important. And people were sort of tortured over this issue. And I don't want to be in a place where this becomes a divider. I don't want to be in a place where this bill is one that has people sort of torn apart in their handling of it. And I felt like this is something that, although we know these children as innocent as others, we could get broad consensus around. It's just, but I wouldn't call that a political consideration.
Okay.
Representative, you don't,
Madam Chair, if I may, just a little
okay, but let
quickly.
me, just a minute.
Mhm.
Representative, don't make me go back on your uncharacteristic thing. If you'll make your answers succinct, and if you will, all the committee members will make their questions succinct, because my board is lighting up. Okay.
Chairman Sessler, your bill does not outlaw abortions nationwide or worldwide, just in the state, which would inevitably create those who have the resources to go other places and other countries can make themselves avail themselves to license and professionals and good facilities, whereas those without resources would avail themselves to not credible places.
Representative Mitchell, if you and I could work together to enact protection for children with human heartbeats in every state, I would ask you to join me.
Okay.
I'd like to lead in Georgia, and then I'd like to have you join me on a nationwide effort to make that happen, because I think it's very important to do that.
How do you feel about the death penalty?
Representative Mitchell, let's stay on issue.
I will tell you.
Wait, no, we're not going there. That's a different issue. You have to bring a different bill and see if it comes to my committee. I figure it probably would go to Judiciary, to your committee. Representative Petrie.
Thank you, Madam Chair. Thank you, Representative Sessler. I just want to try to encapsulate, make sure I've got it right. So currently, the standard in Georgia, if you look, is basically 20 weeks. In the current statute and the current language in this bill, I'm going to get to it here. The current language is 20 weeks or less, right, that abortion is available. And so this fetal heartbeat bill would basically make it plus or minus 6 weeks. Is that customary, about 6 weeks for a heartbeat of a child?
Yeah, 6 weeks gestational age is is approximately when science tells us the heartbeat begins. And 20 weeks is the standard now. And by the way, at 20 weeks, there is no exception for rape.
Right.
It is a pure recognition of the value of that child and their life.
And that was where I was leading. So the exceptions are going to be new to the statute altogether, that we've added exceptions for here: rape, life of the mother, and incest. Well, rape and incest, which are both rape, are new. And so I want to make sure I understand, but this does nothing to encumber the availability of whatever resources a woman might have prior to the heartbeat of a child in the womb.
No, sir. Again, I appreciate the gentleman's question. I mean, we know that life begins at conception. You have a living, distinct human being at conception. And I believe that and they're worthy of full legal protection. I think from the standpoint of looking at what is legally sound, and what I think we can get common sense support to recognize is, certainly we can agree that with the human heartbeat, we recognize, I believe strongly at conception that all children, no matter whether they're conceived through rape or in a loving family, are worthy of full legal protection. I'm going to say that, I'll say it again and again and again, but certainly we can come together and recognize if there's a human heartbeat, that child's worthy of protection.
Thank you, sir.
Representative Newton.
Thank you, Madam Chair. To the bill sponsor, I so appreciate this bill in so many ways. As an emergency physician, I frequently take care of pregnant women, and there's 2 lives involved, and we do our best to take care of them. One of the first things we do often is an ultrasound, as you've mentioned, and that ultrasound, 2 of the things come back: the estimated age and the heart rate. It is a key thing, and I get to go back into some families and have to give bad news that there is no heartbeat and that things are not going well. And I've cried with people with that. I get to reassure others with the fact that that heartbeat is a sign of life. I do that at all extremes, and I appreciate for the elderly, we look at that, we try to revive someone. The way we can tell if it works or not, we get a heartbeat. Everyone knows a flat line. A lack of a heartbeat, which that represents, is a crucial distinction. I appreciate the wisdom to go into this and recognize that the presence of a heartbeat is not a new idea, with that equating to life, and that you've done a great job with this. I appreciate it.
Thank you.
Okay. All right. Can we leave our things to questions, please, since we are on a time schedule? Representative Hutchinson.
Thank you, Madam Chair. I have a question on line 40, section 1-2, where you talk about early infants in the womb. I'm not familiar with this term. Can you define that? Because I think it would make a difference when you start talking about fingerprints and distinct organ systems. So can you define early infants in the
Yeah.
womb?
Thank you for the question. And again, section 1.2, as you know, is legislative findings. But I think it's important to understand, we're talking about infants. We're talking about children that have their own organ systems. We have children that have their own DNA, and so forth. And I think it's clear to use words that mean something. I think the child in the womb is an infant. In fact, children that are growing from, spend probably half their time in the womb. They could live outside or live inside the womb. We know these are infants. We simply use the word early infant as sort of a general term to talk about what we recognize. The child in the womb is not something else. It's not other. It's a human, and but they're early in their development. And I think that's our intention of just recognizing it that way.
I think your answer confused me more, actually.
Okay.
So an early infant in the womb, you said, can be sustained outside of the womb, correct? That's what you just said?
What I'm telling you is when you think about a child, let's take, for example, some of the horrific legislation we've seen in other states.
Succinct.
Succinct.
Is there a definition? Is there a definition? Like,
early infants is infants in their early stages of development.
so a 6-week-old can be an early infant?
Isn't
Because
it correct?
Yes.
Aren't they embryonic at that time?
Because if
If
that's
they're
the case,
with a physician, they're called embryos at the time, or embryonic stage.
because
not
at 6 weeks,
infancy.
they don't have fingerprints.
I'm sorry?
At 6 weeks, they do not have fingerprints.
No, they're developing.
Okay, no, wait a minute. We are not going to have that. If we have this kind of thing from the audience, I'm sorry, I will ask that the officers remove you. I don't want to do that, but I will do that.
Yeah.
Okay.
Thank you for the question. We recognize that children in the womb, from early biological development, from 6 weeks and even earlier, all they need is nourishment and a safe place to live, and they're going to grow to ripe old adulthood. The fact that morphologically certain organs have not grown or their arms aren't as visible doesn't change the fact they're living distinct and as human beings. And if the lady would like to make an amendment to clarify that language, I would welcome it.
Well, I mean, as written, an early infant in the womb at 6 weeks does not have any of these things, unique fingerprints, or they may have genetic, but
Yeah.
this would be incorrect, is what I'm saying.
Children develop in the womb. Before children are born, they come out the birth canal. They have fingerprints. All their organ systems are formed. Their bones are formed. They have brain activity. They feel pain. I won't be able to show a video today that shows infants inside reacting to stimuli, but we recognize that's true. This is simply stating that basic fact we would all recognize.
All right,
I don't think we all
Representative,
recognize it.
go ahead.
So if early infants in the womb at 6 weeks gestational age do not have unique fingerprints, so it's like the basis of what you're saying is flawed, so I'm having a difficult time following the rest.
Right, thank you.
Okay.
Thank you. I'm going to move on. Hold that one. Representative Schofield.
Thank you, Madam Chair. And I do realize this is a very, you're very passionate about this, but so am I as a mom. Just how many times have you actually carried a baby?
As a male, I could get into talking about my wife's miscarriages. I could get into talking about the kids we've had. We've been blessed with 4. but we've had more. We've lost some. So that's
And that was a decision that you and your wife made, correctly? Am I correct?
it's. I mean, we could speculate whether all the children came on order or whether it was sort of the magic of being married. Things happen.
But you had the conversation as to what was going on with her body. It was between you and her. You didn't come and ask the body to vote and to help and intervene with those.
I will tell you, with all of our children, we recognize that when my wife became pregnant, we had a living, distinct child under our care that had the same value as a child that was out to here when she was extremely pregnant, or that was in the hospital with us after birthing, or that we have in high school. I would tell you that in some ways they probably felt more like human beings in the womb than they do as 20-year-olds. But I think we both saw the value of the child with great care as soon as she became pregnant.
Thank you. And just two more quick ones. While I respect that, what I am just struggling with is the right for you to tell a woman what to do and how to do it. But on that note, I want to move to the bill. So I have a question about the fiscal, is there, and you talked about the tax codes and the consensus, the census. So I just really wanted to know if we have a physical note, since we're going to claim this fetus on our tax returns, or do I have to change my withholdings if I lose a child, or there's a miscarriage or something like that? Am I going to be found guilty of tax fraud for not reporting?
No, appreciate the question. There are tragedies that happen among us. If a family had a 6-month-old child that mom delivered 6 months ago, and by some tragedy they lose the child, the last thing they're thinking about is the tax status. To be sure, I think we can agree on that. Mm-hmm. But if you have a child over the course of a tax year, let's say, for heaven forbid, that happened in 2018. Someone lost a child in July of 18 that was 6 months old. Mom, dad, the child, they would have 3 write-offs from their taxes for the year 2018 because they had a child during that year. All we're saying is if a child's in the womb, we recognize the humanity of the child. They would have a write-off if the child is 8 months in utero or 8 months in air. It would be treated the same way.
Okay.
Thank you, Madam Chair.
Representative, I did have a question about that, and having gotten this bill late in the session, I didn't have a chance to ask for a fiscal note because it takes much longer. But, how does someone, since a lot of people don't know they're pregnant until well into, 8 to 10 weeks and sometimes 3, the first trimester, if their menstrual periods are very irregular and they miss them for several months, they really don't have any way of knowing. And so people hate paying income tax. And how would the state have a way of verifying about a pregnancy that early on? I'm just asking how you think we would verify this, or if this part of the law is enforceable. I'm asking for clarification.
Thank you for the question, Madam Chair. It's the same way if a young woman wants to apply for Medicaid, she can't just take the pregnancy test that you get at the drugstore. She has to go down and have a medically verified pregnancy test. When the medically verified pregnancy test happens, then you're able to apply for Medicaid if you need services. Same thing would apply here.
Well,
and I think, and Madam Chair, my goal would be that we not. It's a pretty straightforward thing with respect to the Department of Revenue promulgating rules to support this. As I try as a legislator not to write regs in bills, but I think the same standard of a medically verified pregnancy test would apply here, just like it does for thousands of people every year that are under a Medicaid system.
that makes me, even more concerned about a note because somebody has to pay for that. Mm-hmm. And then I had another question, and this is for clarification for myself. I thought that, and it's about lines 131 to 133, this is for clarification. I thought that the 14th Amendment said that the protections are for the born and the naturalized citizens of our country. I think if you look at the 14th Amendment, it said born.
No, ma'am. I mean, it's if you think about the, if we want to get out I mean, I can pull that out if you need me to, Madam Chair. Happy to. What the 14th Amendment accrues to is persons.
Betsy? Oh.
Oh, we don't count. Um,
Okay. But then it gets on to the other state. Okay, as Betsy clarifies that for me, because I have no internet connection at my house where I live, and so at night I have no way of looking up something like that, and didn't happen to have a copy of the Constitution right at hand. So that was why I wanted to clarify. The other thing is, and we're going to include an unborn child in our state population basis?
Yeah, many of our state population counts are driven by the census. Our voting, all those things are driven by census numbers. What this does, it allows us to include unborn persons or unborn human beings in our counts. For example, if the state makes allocations based on population, we recognize even the areas with the highest birth rates have around 1%, 1.5% of births per year. We're talking about small numbers, but if the state wants to reflect in its policies, whether it's apportioning of dollars across hospitals for high-need hospitals, we recognize that children in utero have high medical costs relative to others, and it's part. There are patients within our medical system that if we wanted to use that, this gives us the ability as a state to do that. It doesn't apply to areas that are only use census data, but it does allow us as a state to do that in those practical circumstances.
Okay, I just have a question about how that would be enforced in there, and the reason is because I did the non-shackling bill of pregnant women, which is now on its way over to the Senate, and one of the things that the sheriffs and everybody, when they're talking to work that out, was, especially in that first trimester, when we say we're not going to shackle pregnant women, and I had to put in there a second and third trimester to make it because it's not so obvious in that first trimester. So the same thing about determining this is what I was asking. Betsy, did you find it?
Yeah, it uses the term citizens of the United States and then deprive any person of the right of life, liberty, and
That's it.
That's right.
Any person. So it doesn't define born or unborn? Okay, thank you.
And Madam Chair, to your point, 38 states in 1868, when the 14th Amendment was passed, 38 states and territories outlawed abortion completely. The idea that it was I think for so many years it was assumed abortion wasn't going to be legal that they didn't even think to mention it, I would argue.
I'm just trying to get clarification about how those would be enforced, and I stand corrected on the 14th Amendment. You misspoke? Yeah. Okay.
With respect to the naturalization of citizens.
Okay, this is Section 1. All persons born or naturalized in the United States and subject to the jurisdiction thereof are citizens of the United States and the state wherein they reside.
But then it goes on to talk about no one shall be deprived equal protection under our laws. So that's.
Okay, I'm not constitutional. I just was questioning that because I thought that it went. I think we'd have to have constitutional lawyers, and I don't think either one of us are constitutional lawyers. Representative Beverly.
Thank you, Madam Chair. To your point on the 14th Amendment, today, as you look at me, you consider me a full person, I suspect. Throughout our history, you have grappled with what the idea of humanity is. Are you familiar with the 3/5 Compromise?
Unfortunately, yes, sir.
Right. And that happened in 1787, where the state legislators tried to figure out how do you qualify a black life. And for the purposes of census and taxation, they said, well, guess what we'll do? The same 38 states, the convention, said we'll qualify black folk as 3/5 of a person. We've always struggled with this stuff. 100 years later, 14th Amendment comes along. It gives people an opportunity to reset what they believe a life is, right? And that's what we're talking about today. And in that consideration, what was the idea around slaves at that time? Do you remember?
Sorry?
Slaves, people of color. What did they consider a person according to the 14th Amendment? Did they ratify? Did they get rid of the 3/5 Compromise?
I would tell you, we knew all along. I think we all know It's almost absurd to even talk about now, but we all know that people of color were full human beings and always were. That laws of our nation didn't reflect that. That in 1857, the Dred Scott v. Sanford decision said that people of color are not persons, they were property. We know that a Supreme Court, in fact, it was a 7-2 Supreme Court decision. A 7-2 decision of the U.S. Supreme Court in 1857 said Dred Scott was property, he wasn't a person. 117 years later, in a 7-2 decision of the United States Supreme Court said children in the womb are not persons, they're lumps of tissue. They're medical things to be accommodated. The same Supreme Court, by a 7-2 decision that didn't recognize Dred Scott, didn't recognize the humanity of the child in the womb, and it's our opportunity to fix that. And I would love you to join me in that.
So here's the thing, that goes beyond the scope of what I'm trying to establish. What I'm trying to establish is that we will grapple as humanity where life begins and who's a person, who's not. And at the core of this is not the moral judgment of a bunch of legislators to determine what the autonomy is of a person who can determine what they want to do with their life. We all have, each one of us have been given inalienable rights. We have those rights. And today you're trying to define what those are. And just like 250 years ago, they said that the guy sitting here, James Beverly, of my ancestors, was 3/5 of a person, and they were completely wrong. Today, I think you're on a slippery slope trying to determine, as a legislator, where life begins.
How can you help? Can you help me through this bill, fully recognize them so it's not 3/5 of a person, but is a full person? Because that's what I'm trying to do.
Okay.
I thank you for that.
Yeah, thank you. And so I think that, Madam Chair, and I'll just, if you just give me one, just
Okay.
liberty, just one other statement, is I'd be happy to have that conversation with you, and I would move to table this, if you're willing to table this, to have an actual real conversation around this issue. And so at the appropriate time, I move to table this bill, and let's see where we go.
I'm not recognizing you for that motion at this time. Thank you. Thank you, Representative Beverly. Okay.
And Mr. Beverly, I'd love to have the conversation.
Can we move on, please? Representative Petrie?
Yes, I was just going to speak briefly. Thank you, Madam Chair. I just wanted to speak briefly. I'm sitting here listening to the dialogue with Representative Beverly and Representative Sensler. And my understanding, sir, is so we already have, to the question, we already have limits on abortion in the state. As I was trying to make sure I understood earlier, we already have an understanding that we limit abortion at 20 weeks. That is an arbitrary position, right? It's just 20 weeks. There's no science behind that. What I see you trying to do here is take some degree of science by saying life begins with a heartbeat, and yes, it shifts that delineation, but it does based on science. Is that not true?
It is, and to your point, the whole idea, and I think the opponents will come and talk about the idea of viability, that this, even in the Roe decision and subsequent decisions, they talked about viability as being the standard after which the legislature can prohibit abortion. And they sort of landed on this nebulous idea of viability being somehow able to live outside the womb. We know that's a medical fiction. A child at 24 weeks gestation age, 40 weeks, heck, a child that's 6 months old can't, without adult help, live on their own. It requires people to care for them. The threshold medically for a viable pregnancy, the point at which 95% of all pregnancies will be carried to term successfully, is the heartbeat. It's the American College of Obstetrics and Gynecology says that the definition of a viable intrauterine gestation is the heartbeat. So we see medically at end of life, as we talked about, if a coroner is trying to decide if someone's alive or dead, if they have a heartbeat without life support, they're alive. This is the medically, scientifically appropriate threshold at which a viability should be applied, and I appreciate the question.
Take a couple more questions, and I'm going to end it and go to public. Okay, Representative Henson?
Thank you, Madam Chair. I have several questions. I'm going to make two of them, just two. I'll make it real quick. If this bill was to pass, where's the fiscal note for advising women who can be pregnant that the law in Georgia has changed? Because I don't expect it to be a billboard on 285.
Thank you for the question. We have when this legislature passed the Women's Right to Know Act back in 2005, we put in place a number of existing requirements that are under existing law. That is, physicians consult women about their options, about the possibility of abortion. There's materials that before an abortion can be performed that have to provide. There's a website that speaks to that. So our existing law prescribes information for women that are considering abortion. Many women who are considering abortion in 2019 or 2020 weren't considering it in 2005.
That's not where I'm going, because you're assuming that she has gone to the doctor. I'm talking about someone who's 4 weeks pregnant that hasn't gone to a doctor, that might not know she's pregnant, because many women don't realize until they're 6 or 8 weeks pregnant that they're pregnant, especially if they're not hoping to be pregnant. They're not thinking they are. So who's going to advise them? I mean, how do you ask a young child, a young 13 or 14-year-old, or even someone that's in college, that if they get pregnant, they have to remain pregnant, and what are they supposed to do with the baby afterwards? And don't talk to me about foster care in Georgia, where we have 14,000 children waiting to get into a foster home. So what are we going to do with all these children that we're now forcing women to carry?
Appreciate the lady's question. There were two. The first question, I think, it answered itself with respect to physicians in Georgia are the only ones that are allowed to perform abortions. Mid-level practitioners don't do it. It's a physician.
Look.
And the notification provisions we have under existing law would apply to this. It really has no this bill has no impact on that. The lady's second question is I think it was one of unwanted children.
If I don't want a child, what am I supposed to do for 7 or 8 or 9 months?
Representative Hanson. Excuse me, sir. Can you sit down, please?
I'm sorry. I believe very strongly that a bunch of men should not be dictating to me about my body, and if I was to become pregnant, what I have to do. Not supposed to do, but have to do.
Okay. Appreciate the appreciate the lady's question.
Yeah,
I can speak
thank
to
you,
it.
Representative Henson. I said I was going to take a couple more questions. I've had my two. We really do need to move on. So, Representative Hutchinson, can you do okay with a wave? Okay, and Representative Sharper, can you get by with a wave, or do you have a really short one? It'll be real short. Okay, and that's it. That's the last one.
All right, thank you, Chairman. Thank you for the presenting this. But when we look at the IRS situation where you said that a person is considered a whole person, let's just say a young lady get pregnant in June. She's pregnant. It's verified by a doctor. Have you looked into how they would have some type of Social Security number in this situation, the whole process on that end? Because if she claims that child as soon as she can, maybe in February, get money, $4,000, whatever it is, and then that something happened with that pregnancy and the baby dies, what happens at that point?
Appreciate the question. And again, just for clarity, this is not going to affect federal taxes. So there's not an issue as far as federal taxes goes. The dollar amount we're talking about is a maximum of $172.50. That's a full tax write-off for a child. Okay. So I'm not touting this as a big windfall. It's really not that much money, but I do think it's important to recognize it. But as I answered the lady's question earlier, if a family tragically lost a 6-month-old or an 8-month-old during a single tax year, they're not thinking about a tax write-off. But when they do their taxes, they had a child during that tax year. Even though the child passed away, that child counts as a member of the family. It would be no different under this.
Okay.
All right. Thank you very much. We're going to go to the speaking list. We have 30 minutes on each side. That's an hour. We're going to keep time, and I'm going to go back and forth. I'm going to start with against, because we've been listening to the pro. Okay. So can you keep time on both times? Okay, Representative Dreyer, if you're still here. No comments from the peanut gallery either. I'm trying to keep the citizens in line. You stay in line too, everybody. Trying to run a tight ship. Okay, Representative Dreyer.
Madam Chair, thank you very much. And there are going to be, I believe, 6 representatives that have signed up to speak against this bill. For the purposes of maximizing testimony for the committee like the chair requested, we each have a doctor that's going to come up with us, and we will proceed in order. We will keep our time to 5 minutes, so the whole presentation can be 30 minutes, and it can hopefully provide the most useful information to the committee.
Well, I need to go back and forth, so can you handle that?
We can certainly handle that.
Okay.
Thank you very much.
All right.
But as my doctor that's with me makes their way up here, I do want to say that, and it was flagged earlier, there is not a fiscal note. And in addition to notification provisions, this is going to provide a tax deduction. We have no idea how much this tax deduction is going to cost. There will also be criminal enforcement costs that are going to go with that. We have no idea how much that's going to cost. And there'll be 2 tiers of constitutional challenges with this. First, the challenge under the current U.S. Supreme Court law. But secondly, this bill provides standing for individuals to continually sue the state of Georgia over the provisions in this bill. So we're going to have massive costs. We have no idea what they are. And in my mind, that would, on its own, justify a tabling so that these uncertainties could be arrived at. Thank you very much. Would you introduce yourself?
Yes, I'm Dr. Al Scott. I am not familiar with the substitute bill, so I'm going to address House Bill 41. Good afternoon, Madam Chair and members of the committee. My name is Al Scott, and I have the honor of serving as the incoming president for the Georgia OBGYN Society. The OBGYN Society is a state medical association for OBGYN physicians. Today, I proudly represent more than 1,000 OBGYNs from all over Georgia. As a member of the Georgia OBGYN Society and a practicing obstetrician for more than 30 years, I rise today to voice the Society's strong opposition to House Bill 481. House Bill 481 proposes banning abortion after detection of a primitive heartbeat, which occurs as early as 6 weeks gestation. It should be noted that what is detected via vaginal ultrasound as early as 6 weeks gestation is not a heart, but a collection of tissue that will eventually form a heart. The bill does not allow for exceptions due to rape, and the substitution bill has slightly changed that, but the original bill did not allow exceptions due to rape, incest, or medically futile pregnancy. This means that if a child is determined to have anencephaly, a condition is not detected until 18 to 22 weeks gestation and is associated with malformation or no formation of the brain, the mother would be required to carry the child to term and deliver the baby. Further, an amniocentesis is a test typically performed at 15 to 18 weeks of pregnancy. This test can indicate certain birth defects. Cells in the amniotic fluid can be tested for chromosomal disorders and genetic problems, such as cystic fibrosis and Tay-Sachs disease. This bill is an unnecessary political interference in the practice of medicine. Nearly 50 years ago, and as recently as 2016, the United States Supreme Court has affirmed that women have a constitutional right to abortion. The bill bans abortion long before the point of viability, regardless of what the state of Georgia prints in law. Whether a fetus is viable is a medical determination and occurs much later in pregnancy. This bill violates the Constitution and will serve as an outright ban on abortion for most women in Georgia, as more than 80 counties do not have an obstetrician, and will prohibit healthcare providers from providing ethical, necessary care to their patients. Safe legal abortion is a necessary component of women's health care. Many factors might influence or necessitate a woman's decision to have an abortion, including contraceptive failure, barriers to contraceptive use and access, fetal anomalies, illnesses during pregnancy, and more. Women often are unaware they are pregnant prior to 6 weeks. And surgical abortion before 6 weeks may be difficult or impossible due to limitations of ultrasound imaging so early in pregnancy. Decreasing women's access to abortion will likely increase negative health outcomes and complications, including maternal and infant mortality. Georgia already has the worst maternal mortality rate in the nation, and the state has invested funds to reversing that disturbing trend. The legislation proposed, this legislation proposed to turn back the clock to the time before Roe v. Wade, a time when women seeking to terminate a pregnancy were forced to resort to self-induced abortions, which often resulted in serious complications and death. Like all medical matters, decisions regarding abortion should be made by patients in consultation with their healthcare providers and without due interference by outside parties. Like all patients, women obtaining abortions are entitled to privacy, dignity, respect, and support. Just a little bit more, Madam Chair. Many factors influence or necessitate women's decision to have an abortion. They include, but are not limited to, contraceptive failure, barriers to contraceptive use and access, rape, incest, intimate partner violence, fetal anomalies, illness during pregnancy, and exposure to teratogenetic medications. This bill indefensibly jeopardizes patients' health by requiring patients to wait and see if a condition deteriorates before permitting medically indicated treatment. Physicians cannot always predict what course medical conditions or complications will take or how quickly they may lead to health problems, severe injury, or even death. This bill could place doctors in the untenable position of denying needed services to women whose pregnancies threaten their health. In summary, House Bill 481 is a bad public policy. Bills such as these have already been deemed unconstitutional, but more importantly, this bill will increase suffering of women who are being forced to carry a pregnancy to full term, a pregnancy she may not want through no fault of her own, simply because she lives in one of Georgia's 80 counties that does not have an obstetrician. Instead of talking about ways to force women to remain pregnant, we should be talking about ways to improve access to health care and reducing maternal mortality, which is the conversation this state most desperately needs. Thank you for the opportunity to speak today, Madam Chair. I'm happy to answer any questions the committee might have.
Unless somebody has a pressing question, which doesn't go against the time. Okay, Representative Beverly.
Just for a point of clarification, questions will not be counted against this
No,
speaker's
sir,
time.
they won't.
And could you, after each speaker, let us know what the balance of our time is, if you don't mind, so that we would have a better understanding of which way we go.
You have 22 minutes left.
Thank you.
On 22 minutes. Okay, all right. On the other side, and you identify who you are and.
Madam Chair, I'd like to recognize Dr. Kathy Altman. In fact,
Okay.
Dr. Altman, would you want to present from here, or?
Thank you, Doctor, for representing the OBGYNs.
Chairman Cooper and committee members, thank you for inviting me to participate in this hearing today in favor of HB 481. 30 years ago, I would have agreed with my colleague. My name is Dr. Kathy Altman, and I'm speaking on behalf of the Charlotte Lozier Institute as to the medical facts represented in this bill. The rest of my testimony is based on my experience as an abortionist and an OBGYN doctor, as well as my own personal experience. I've also written, I have a written testimony which I would like to submit with documentation. I'm a retired board-certified OBGYN and fellow of ACOG with over 35 years' experience. I've been an advocate for women and their health issues for my entire career. I was co-founder and co-director of the First Rape Treatment Center in Jacksonville, Florida, and performed sexual assault exams on women and children as a medical examiner. I served as the medical director for Planned Parenthood of Jacksonville, on the Ethics Commission of the Christian Medical and Dental Associations, and on the Board of Community Health Outreach, which provides free medical care and food to the poor. I've testified extensively at the state and federal level on a variety of pro-life issues, including the heartbeat bills in Iowa and Ohio, and before the U.S. House Subcommittee on the Heartbeat Bill. I've performed first trimester and second trimester abortions and treated the complications of abortions. I've taken care of women and their babies throughout normal and abnormal pregnancies and treated the complications. I have had an abortion and 2 vaginal births. When I entered medical school, I believed that the availability of abortion on demand was solely an issue of women's rights. I felt no more compassion for the fetus than I did for the chick embryos I dissected in college. I continued to do abortions without reservation even while pregnant. But after my delivery, I made the connection between fetus and baby. The fact that the baby was unwanted was no longer enough justification for me to kill it. Although I could no longer do abortions, however, I continued to believe that abortion was a woman's right. My views changed during my practice as I saw young women who did amazingly well after deciding to keep their unplanned pregnancies, in contrast to those who were struggling with the emotional and physical complications of abortion. That wasn't consistent with the feminist rhetoric I had embraced. My opinion also changed as I watched children grow up in my church who were almost aborted, including one with Down syndrome. I realized that those precious little people wouldn't be here if their mothers had aborted them. Abortion is damaging to women. The physical and psychological risks of abortion are well documented but are woefully underreported. A woman cannot remain unscathed after killing her child. At some point, usually after childbirth or the inability to get pregnant, the realization of what she did hits her. It wasn't until after I had my first child that I regretted my own abortion. I wish there'd been a heartbeat bill back then, or that it had not been so terribly easy to get an abortion. We have convinced our young women that an unplanned pregnancy is the worst thing that can happen to them, and that their right to reproductive freedom is more important than their baby's right to live. Because we can't see who they will become, we feel justified in sacrificing the lives of babies in the womb for the convenience of those that we can see. I support this bill because it uses the heartbeat, the best indicator of the viability of a pregnancy, and a very concrete sign of life that people can identify with to determine when the fetus should be protected, rather than the viability of a fetus outside the womb, which is dependent upon the technology available and the willingness of medical personnel to treat. Although it's rarely necessary to abort a baby to save the mother or to protect her health, there is a safeguard in this bill to protect the life of the mother and to prevent a serious risk of substantial and irreversible impairment of a major bodily function. Scientists understand that a human life begins at conception, and that development doesn't stop at birth. The cardiovascular system is the first organ system to reach a functional state. The heart begins to beat at 3 weeks and 1 to 2 days post-fertilization. Blood flows beginning in the 4th week post-fertilization and on the 6th week of gestation, and the heartbeat can be detected on vaginal ultrasonography. Transvaginal ultrasound can detect the heartbeat between 6 to 7 weeks gestation, as opposed to 7 to 8 weeks by transabdominal ultrasound. The small handheld Doppler that providers use in their offices is the least sensitive And although it can sometimes pick up the heartbeat at 8 to 9 weeks gestation, it may not be detected until 12 weeks gestation. If present, the heartbeat is the best indicator of a viable pregnancy. Once a heartbeat is identified, there's a very strong likelihood that the pregnancy is viable and will continue to term. I want to thank those of you who have supported this bill for your vital efforts to protect those who have no voice and cannot protect themselves. Thank you.
1.5 minutes left. Thank you very much for your time. Okay, where'd Representative Dreyer go? Okay, you're going to need to cut it to about 3 minutes because I left somebody. I had a wrong sign. I've got to get to somebody else before your 30 minutes is up. Go. Who's going next?
Madam Chair, my name is Angelica Kauscher, representative for House District 50, and I'm yielding my time to Dr. Katke.
Okay.
Good afternoon, Madam Chair and members of the committee. My name is Dr. Melissa Kotke, and I'm a member of the advisory board of the Georgia OBGYN Society, the state medical association for OBGYN physicians. I'm an assistant professor in the OBGYN department in the Emory School of Medicine and have been practicing obstetrics and gynecology here in Georgia at Emory and at Grady for 13 years. I'm here today to speak as a member of the Georgia OBGYN Society, as a member of the American College of Obstetricians and Gynecologists, in strong opposition to House Bill 481. The members of the OBGYN Society, ACOG, and myself have dedicated our careers and our lives to secure healthy futures for our patients and their families by providing high-quality, evidence-based health care. The Georgia OBGYN Society and leading national medical organizations like ACOG and others support the availability of safe, high-quality reproductive health services for all women and is committed to protecting safe, legal access to abortion as a necessary component to women's health care. House Bill 481 is bad policy for Georgia's women and Georgia OBGYN physicians for several reasons. First and fundamentally, House Bill 481 is built on a foundation of false and misleading statements and scientific inaccuracies. For these reasons alone, it should not be considered. Representative Setzler, I appreciate and agree your assertion that, I believe you said, we should trust our doctors. This bill does exactly the opposite. House Bill 481 takes medical decisions out of the hands of my patients and me, and instead puts medical decisions into the hands of politicians. Not only does this compromise the integrity of the patient-physician relationship, it is extremely dangerous for lawmakers to presume that they're better equipped than women and their healthcare provider to judge what's appropriate medical care. Or, as this bill does, proposes to create a new medical definition. Next, House Bill 481 would lead to worse health outcomes for women in Georgia. In the everyday care of patients, I see time and time again that the real-world context and the real-life medical situations of my patients are complex and are nuanced. There are innumerable situations that happen in real life that are not reflected in House Bill 481. For example, our team recently had a female patient, a mother of 3, who was diagnosed with breast cancer early in her pregnancy. Breast cancer is one of the more common cancers diagnosed during pregnancy, and these tumors grow actually in response to the hormones of pregnancy. It's difficult to call this an emergency and completely unethical not to offer her an abortion if she would like to focus on treating her disease and giving her the best chance at long-term survival. Indeed, there are many medical conditions that put a woman at increased risk for adverse health outcomes during pregnancy. These conditions may not present impending death for the woman, but they can undoubtedly cause her harm. House Bill 481 indefensibly jeopardizes patients' health by requiring physicians to wait and see if a condition deteriorates. We don't have a crystal ball, and I can't tell you if one mother is going to get sick or at the speed at which she's going to get sick. Things can change very, very quickly in the world of OBGYN. That's the reality of working in this field. This bill would place doctors in the very difficult position of denying services to women who need them during pregnancies if their pregnancies threaten their health. They would feel the need to wait for a higher blood pressure, wait for a higher fever, really got to justify this one, bleed a little bit more is what we're asking physicians to do. Imagine this was happening to your mother or your wife, and I, as your physician, came out to greet you in the waiting area of the hospital and said, you know what, I'm really, really worried about her. And it's my medical opinion that this pregnancy is causing what we're seeing. But I'm sorry, she's just not sick enough yet. I can't do anything for you. Next, we have seen time and time again that where abortion is illegal or highly restricted, women resort to unsafe means to end unwanted pregnancies. This can include things like self-inflicted abdominal and bodily trauma, ingestion of dangerous chemicals, self-medication with a variety of drugs, and reliance on unqualified abortion providers. In comparison, legal abortion is incredibly safe. States that have more strict abortion restrictions have worse maternal and child health indicators. And this disproportionately affects people who are poor and women of color. Finally, House Bill 481 unduly punishes women's health physicians for providing critical care. This bill would criminalize me for being an OBGYN, criminalize me for providing evidence-based, high-quality medical care. In addition to finding that personally and professionally unacceptable, I believe this will have a devastating impact on the state's already inadequate physician workforce. Currently, there are 80 counties in Georgia without an obstetrician. That's over half. And we have one of the worst maternal mortality rates in the country. I do not believe that those two things happening are a coincidence. Bills like House Bill 481 act as a deterrent for OBGYNs to practice in the state of Georgia, and the dearth of obstetrical services will worsen. Who would want to come to this state in a practice that is hostile to the actual practice of medicine? Who would want to come to Georgia where you might get put in jail for doing your job? House Bill 481 will worsen our provider shortage. It'll worsen access to obstetrical care, and no doubt will worsen our maternal mortality and morbidity rates along with it. We can't allow this. The Georgia OBGYN Society urges the committee to vote no on House Bill 481.
Thank you very much. What do we got left? You have 16 minutes left. Okay. Do you have somebody you want to choose, since I have this overwhelming number of people? Okay. If you will identify yourself, and if you're with an association or whatever. They can present from the place there.
Thank you, distinguished members. I'm sorry, I was not planning on crying, of course, but it's hard. I cannot thank you all enough for being here and for the hard work that you each put in.
And you are?
Rachel Guy, sorry.
Okay, and you're just testifying for yourself? Oh, okay, Rachel, we're not going to jump over here and make it hard for you. Just be calmer, and it's okay. Thank you.
But thank you all. I know that each of you have taken time out of your day. I know that this is a, quote, loaded subject, and I cannot thank you enough for hearing this. I wanted to ask that you would use the power that the Lord has given you and entrusted to you to save babies like myself. You see, over 20 years ago, 3 doctors told my parents to abort me. They said I was incompatible with life. They said I would not live long. They said if I did live, I would have no quality of life. I would be blind. I would be deaf. I would have mental struggles. My parents said our child is value, regardless of if our child is blind, is deaf, has mental struggles. No parent regrets choosing life. And I think about all the families. There were 3 specific doctors who told my parents you need to abort. One doctor said the only test we will offer you is an autopsy. All 3 of them washed their hands of my life. And I am asking you, not only on the behalf of hearing my story, but on the behalf of countless children who their only crime is that they're sick and they're in utero. And I ask that we fight for these children. These children deserve rights. These children are patients. These children are patients of doctors. And these precious children deserve the right to life. I think about precious children who have disabilities who are outside the womb. And doctors fight fight the good fight. They care for these precious children because they are their patients. But when they are inside the womb, there's somehow this justification to preemptively take their life and to eugenically target them, to believe that somehow they're not valuable based on their disability. When in fact, when they're outside the womb, we cheer them on for the ability that they have, despite the disability. And I ask that we see the ability that these precious children have inside of the womb, and we do not discriminate against them based on their disability. Thank you.
Thank you for coming to testify. You have 22 minutes left. Thank you very much for coming and testifying. Okay, next.
I am proud to represent the district, including Grady Hospital and this Capitol. I am disheartened that this committee time and agenda has been covert. The sponsor has been sticking to talking points and has not addressed the true dangers of this bill and has evaded very specific questions. I stand here today confident in my decision to terminate my pregnancy when I was sexually assaulted in 2010. As a member of the LGBTQ community, there are many people who believe they can rape us straight. I do not deserve to live in a world where people believe I deserve to feel pain because of my sexual orientation. Many of you know I now help women in English, Español, y Portugués who are determining this decision. Today I bring to you my concerns with this bill. I have amendments I have given to members on the committee. I'm happy to share them with anyone. I have reached out to every sponsor on this bill to speak with them about my concerns. Including fetuses of 6 weeks in the census is impossible, as this bill calls. Women make up 52% of the state population, so even if half of those women were pregnant, there would be a major new set of numbers for us to calculate. There is no way for us to do this. It is a flawed idea. It begs that women who are pregnant can ride in the HOV lane, and it asks if we use life insurance to do this. Opening physician records to law enforcement is not only terrifying, but there is nowhere else in the code where this exists. I want to make it clear that heartbeat is not the indication of viability by reading testimony from a constituent who couldn't be here today. My first son, we have a perfectly wonderful ultrasound photos showing a nice healthy heart beating fetus that we use to share the news with everyone. At the time, even during gestation, any brain matter he grew just floated out there with the top part of the skull not holding onto it. As it was floating, the amniotic fluid burned away at it. At that time, the law of termination was set at 24 weeks in Georgia, and now we're at 20 weeks. I yield the rest of my time to Dr. Roche, a doctor from Emory.
Good afternoon. I appreciate the opportunity to speak. I've devoted most of the 50 years of my professional life to preventing maternal deaths from abortion in Georgia, United States, and internationally. Internationally, 56 million women a year get an abortion, 46,000 die. The situation in Georgia in 1969, when I was first assigned by CDC to the State Health Department, was to evaluate Georgia's law decriminalizing abortion, which occurred April 1, 1968. I reviewed the death certificates for the previous 20 years and noticed that most of the deaths were older, rural African-American women. Those who had been getting safe abortions during the short time period that this restrictive law was in place were younger white Atlanta women. Marjorie Pitts Hames, an Atlanta attorney, used that evidence of inequity as part of her argument to sue the state of Georgia and take it to the Supreme Court, which ended up being Doe v. Bolton decision. And I wish that were the end of maternal deaths from abortion in Georgia. 12 years later, I was again working in the state of Georgia, and I was asked to investigate the death of a young woman, third year of college, African-American, who had made an appointment to terminate her pregnancy, been to the facility, was deterred by protesters, went back to her residence, undid a coat hanger, and inserted it into her cervix and uterus, perforated her uterus, and subsequently died. I saw the track marks at the Fulton County Medical Examiner's office, and I read her medical report, her social history, and why she hadn't informed her parents. I think restrictive bills, however they're formulated, are particularly disadvantageous to minority populations, and particularly to African Americans, based on this evidence. Thank you.
Okay, you have 12 minutes left. Now, who would you like to go? Okay. Miss Nicely?
Yes.
Okay, if you tell
Yes.
me what you do or,
Yes.
okay.
Daphne Nicely. I'm the executive director of Atlanta Morning Center, and I'm not here taking a position on the legislation, but to provide information regarding my observations and experience. I'm previously the executive director of a pregnancy center. Pregnancy centers offer viable service in the community, providing limited medical services as well as material assistance and educational assistance for mothers as well. What Atlanta Morning Center does is not a pregnancy center, and it actually answers some of the questions that our esteemed committee members have asked today. But we provide prenatal through postpartum care in underserved communities to underprivileged women, those that are socioeconomically depressed, impoverished, medically indigent, or do not have insurance, and we provide the medical services at no charge. Not only do we provide our medical services at no charge, but we do not accept government funding, nor in fact even apply for it. When I was the executive director of Atlanta Pregnancy Resource Center, we did not take advantage of the opportunity to accept the Georgia Alternatives to Parenting and Pregnancy Grant, and we do not intend to do that now. So this is a way that is fiscally responsible. We provide these services with funding through individuals and churches and other organizations. We partner with the community to offer additional services, fatherhood program, abortion recovery services, parenting classes, couples classes, and other things that are available. The maternal mortality rate in Georgia isn't one of the worst. It is the worst in the nation. As a matter of fact, the United States is third of all developed nations in the world. We're doing an atrocious job when it comes to the health of our pregnant women. But it doesn't end there. We're 41st for low risk C-sections, 42nd for premature births, 42nd for prenatal care started before the third trimester, 45th for low birth weight babies, 46th for infant mortality as well as neonatal mortality, 48th for uninsured women, and last in maternal mortality, and that's only with Rhode Island and Alaska not reporting. As executive director of Atlanta Morning Center, it's our desire to have a positive and life-affirming impact on maternal, fetal, and pregnancy health, childbirth, and throughout the postpartum period. I would like to also add that I have chaperoned or witnessed hundreds, if not thousands, of ultrasounds professionally as well as my own. I've had 12 pregnancies, 11 of those miscarried, but not once have I been able to determine how or the manner of conception of the child. Thank you for your time and your service, and if anyone has any questions, I'd be happy to answer them.
Representative Mitchell.
That raises a very interesting point, not being able to determine how conception starts. This bill contemplates a political exception for rape and or incest. I would wonder how in the world would you be able to determine that the pregnancy came about as a rape or incest, even proving that in this day and age, as you know, is difficult, as well as most rapes go underreported, and I'm sure having a pregnancy as a result of family members probably is equally as unreported, if not more so. And I was wondering, how would you be able to determine that?
To the gentleman, if the gentleman wants to help us pass a bill that does not have that exception that can protect all life, I would join you in that. That would certainly be my policy. I think the concern is how do we protect many? I think Ms. Nicely would agree. We need to protect all. The idea of having exceptions is not really the prototype or the ideal.
Well, I'd love to. I think the Representative Beverly made a suggestion earlier that we table the bill and then so we can sit down and work out those differences. I'd love to do that, be honest with you.
But I'd like Ms. Nicely to speak to your question about the value of the life.
Yes, I believe that all life is precious and would hope that it would not have any exceptions.
Sorry, did I miss a question? Okay. You have 19 and a half left on your minutes. Sorry. All right, next.
I'm Representative Shannon, and I appreciate the doctor sharing her abortion story, and now I'll share mine. I had an abortion almost 20 years ago. I did not regret the decision then, and I do not regret it today. We can talk about our differences in values about whether or not you think a woman should have the right to choose, but if the sponsor has done any research on this bill, he knows that in other states where they've passed restrictive abortion bans, it has always resulted in a pitting of the doctor between the doctor and the patient, which has resulted in doctors having to turn in their patients, and therefore you see patients lie about their health needs and what has gone on with their health care. And we have even seen women in Georgia criminalized and taken to jail because they attempted pregnancies in areas where they did not have access to OBGYNs. And so we've already seen those issues. We can all agree that we have a shortage of specialists. We all know that. We do agree on those points. We would not want to pass a bill like this, which would have the unintended consequences of driving more doctors out of the state. I yield the rest of my time to Dr. Crystal Redmond.
Good afternoon. Thank you for allowing me to speak. Thank you, Representative Shannon. Again, my name is Dr. Crystal Redmond. I'm a public health physician in the state of Georgia. I'm here on behalf of Spark Reproductive Justice Now. We're a reproductive justice organization in Georgia, as well as on behalf of the Reproductive Health Rights and Justice Coalition in Georgia. In considering Georgia's extreme, inferior, and detrimental health crises, especially amongst Black women and queer and trans folks, we should be here to discuss proactive ways of advancing our healthcare systems, practices, and outcomes. Rather, our fellow legislators are playing politics with our wombs in Georgia. We are here to discuss inserting government in our families' personal and private life decisions. I am sure that this Health and Human Service Committee is aware of Georgia's current status of our health report cards. However, let me go over a few statistics so I can make sure we're all on the same page. First and foremost, and most importantly, we have not expanded Medicaid, and our rural hospitals are closing at a rapid rate, which typically the first service to go is our labor and delivery ward. We have biomedical inequities and limited to zero access to comprehensive health care for marginalized groups of the state of Georgia. The CDC has issued a pandemic warning due to our astronomical HIV rates and its compatible rates to third world countries, as some of my colleagues have stated. We are in a maternal health crisis, specifically for Black women, who are 3 to 4 times more likely to die due to pregnancy-related issues than white women. Again, as our colleagues have said, we are 50th in the nation in our country in negative Black maternal health outcomes and 48th for women overall. Our current healthcare laws are outdated and are not supported by evidence-based medical knowledge and modern science, such as our HIV criminalization laws, and we have no uniform comprehensive sexual education program in the state of Georgia. I can continue on with this list and lay out our healthcare landscape, but we're here for specifically House Bill 481. Georgians deserve policies and systems and structural barriers to adequate reproductive and comprehensive care and provide universal and meaningful access to quality health care. And as a public health doctor and former director of our family planning division for the Georgia Department of Public Health, I would love more than anything to be standing here today to discuss how we can strategically work to inform and improve all of the factors I just mentioned. But instead, we are here to discuss this bill that is designated to attack and hurt Georgians and worsen our healthcare outcomes. So again, let's talk about it. This blatantly unconstitutional bill is an attempt to ban Georgians from having an ability to receive abortion care, even banning abortions in the very early stages of pregnancy, as early as 6 weeks, and before many people know they are even pregnant. This bill is cruel, misinformed, and dangerous. Georgians are tired of our government politicizing very personal and private decisions that should be made by individuals in consultation with their physicians and their families. Additionally, providers who, like myself, also vote and are tired of legislators interfering with our provider-patient relationship, which in effect hinders our quality of care we can administer. Besides the bill not only criminalizing abortion before most people know they are pregnant, there are other alarming factors, such as there is no exception with the amendments here to race, incest, or medical anomalies. So if you can detect a fetal heartbeat, but there is still another anomaly which makes the fetus incompatible with life, the patient will still be forced to carry to term and endure mental anguish, as well as to be put at risk for sepsis and infections. This bill does not consider if the patient has been diagnosed with a terminal or chronic medical condition. It also does not consider the differentiation between a medical and surgical abortion and a spontaneous abortion, also known as miscarriage. So in the event a person who was to experience a miscarriage and was in need of medical intervention, that provider is now at risk of criminalization, and prosecution just for providing needed care. Or the patient would be at risk of infection and sepsis again because the miscarriage is incomplete and tissue from the pregnancy still remains in the uterus. This bill creates concern in the medical community around potential prosecution solely for doing our jobs, and as a result, will push OBGYNs and other medical professionals outside of Georgia, as some of my colleagues have stated. And as I mentioned in my opening statement, we cannot afford any additional negative hits on our healthcare outcomes based on lack of providers in our state. This bill will require pregnancies to be counted in state populations as well as state income tax purposes. So my question to this committee is, who will be providing the state of Georgia with each patient's medical records, and will this affect any type of HIPAA violations? Last, medically performing an abortion at or before 6 weeks puts our patients at risk of complications and is perilous to perform at that point, as the embryo is difficult to detect on the ultrasound, which makes it difficult to detect the person is pregnant, as well as obtaining confirmation that the pregnancy was successfully terminated. This is exactly the reason why legislators who do not have medical backgrounds should not be making decisions on policies around medical practices, as evidence-based best medical practice is not being considered in these policies. Lastly, we know that this is unconstitutional under current Supreme Court precedent, which this bill is specifically challenging. Why should Georgians pay to implement and defend a clearly unconstitutional attack on our bodies and our pocketbooks? The decision about whether and when to start or grow our families should only be made from the persons in consultation with family and provider. When people can make decisions that are best for their lives, families thrive, and we build communities where each of us can participate with dignity and equity. Bodily autonomy is a human right and a tenet of reproductive justice. The government should not interfere in these personal decisions. It's time lawmakers that call themselves quote unquote pro-life spend their energy focusing on the very real problems Georgians face, such as, like my colleague said, 79 to 80 counties that have no OBGYN or no and our maternal mortality rates, which which are the worst, but in our nation. Again, and lastly, the author of this bill has said trust doctors, and doctors are saying no to this bill. Thank you, and I'll accept any questions. Thank you. Questions?
What, they have 5 minutes left. Okay, Ms. Hobbs. Wait. Got a question.
Well, it was just, to your point, I found out that the ACLU, that rape and incest provisions would likely require a court order. Can you tell me if you're aware of that?
Do you more detail?
Well, obviously, we don't know if the embryo and conception is at a certain point, and if there's a rape and an incest, how do we prove? And wouldn't that require that there would be a court order mandated for us to even prove that?
If in statute we require that, in the statute, if you read the bill, and I can point you to the.
Oh, I read the bill.
Okay. Let me point you to.
Because I didn't see it, so I'm thankful for pointing it out.
Page 6 of the bill. And once again, if the ladies would look, the result of a rape or incest, which an official police report's been filed alleging the offense of rape or incest. So we feel like this gives a very broad berth. If the lady would prefer a court order, then we could entertain your amendment to do that. I think, from my vantage point, I think it's probably more accommodating to someone. If they file a police report, which is an official statement, then they would be cleared to follow through this if this is their desire. I agree, inserting a court order in there is a policy question. If the lady thinks that's to her likings, then I would entertain that debate.
But to my colleague's point, that
I
a
think
fourth of the rapes are not even ever reported. So.
I think the goal here is if there were a police report filed, then that threshold would be satisfied.
Thank you.
Thank you, Madam Chair. Chairman Setzler, I have also been looking at lines 163 through 166 that my colleague just brought up, and it strikes me that the Me Too movement began in 2017. So you had a lot of women that perhaps have been raped. We've not heard about incest yet, waited a long period of time to come forward. I'm disturbed by this official police report. How do you address that in your line of thinking?
Yeah.
What factors do you think forces a woman to seek an abortion?
Yeah. Well, those are maybe different questions. Do you want me to answer what leads a woman to seek an abortion, or do you want to speak to the police report question?
Both, if you don't mind.
Okay. Well, let me say, first of all children in the womb are human beings that are worthy of protection. You know, we talk about the issue that was raised, to address your point, the issue was raised about this bill being a cruel bill. Every child that's aborted is either chemically aborted or they're pulled apart piece by piece from inside their mother. In fact, the medical practice requires that when children are aborted and pulled apart, whether it's through suction or through instruments, the doctor has to reassemble all their body parts to make sure all the parts have been assembled outside to make sure everything has been evacuated from the womb. That's what's happening to every single child. For 30,000 children a year, that's happening to. That is the most brutal cruelty of anything that happens illegally in this state under us as a General Assembly. So to your point, I'm very sensitive to women who are in crisis circumstances. Ms. Nicely talked about that she dedicates her life to supporting these women.
Wait a minute. Okay. Sorry, Madam Chair. That's right. Representative Setzer, if what you described is the way it happens, I agree with you, that's cruel. But it's not more cruel than anything that's ever happening to any of our children in our state. We just had children starved, left in a cage to where their arms would not go out, and then the families put them out like this and strapped them to a tube so that when the authorities didn't do it, and starved to death, and then buried in a backyard. So, I would take exception to that about the cruelty. Okay?
All of these are horrible.
Horrible stories. So but horrible things are happening to Georgia children. Okay? Horrible things.
Horrible things.
I'm sorry. I'm passionate about what's happening. Okay. Are you through, Representative Trenner? Okay.
In answering your question very briefly, Madam Chair, it's the difficulty of that circumstance that you're outlining. That we members have come to me and said, because of the difficulty of that circumstance, let's try to bring this legislature together in a bipartisan way, and let's recognize that if we're going to have a prohibition for abortion at a point of fetal heartbeat, members have come to me and said, Representative Setzer, can we give them to 20 weeks? And I weigh the value of these precious human lives, which we know are human and worthy of protection, and this sentiment among our body. And in weighing that out, I've tried to recognize that in this amendment because of the seriousness of the circumstances you're talking about. Right now, under this, they would have the same 20 weeks under this bill they have today. That would not change. So women who are raped today have 20 weeks to make this decision. That would not change under this bill because of the circumstances you raised.
Okay. Two more questions. Representative Mitchell?
Thank you, Madam Chair. Mine to be very quick. It just illuminated lines 164 through 166. Let me just ask of the author, my good friend Chairman Setzler, to let me make sure I understand this. To take advantage of the political exception
you have to allege that you've either been raped or been impregnated by a family member and file a police report, and therefore you can take advantage of the political exception. Is that correct?
Again, I challenge the gentleman's premise. It's not a political exception, and I don't think we can trivialize. I don't want to accuse the gentleman. I'm sure you're not trivializing this. We're not creating a circumstance where people can just go down there and make a false statement. This exists for women who have been through the horror of a rape, and there's nothing to that's not trivialized, and we're not giving them the ability to skip down there and do anything trivial. This is a very serious circumstance. We provide them a mechanism that, in filing an official police report, they can have access to what I believe is a bad decision, but I'm trying to make this an issue that we can come together in a bipartisan way.
Right. If I may, Madam Chair, further, you started out in proposing the bill of how scientific it was. I heard no differentiation between the scientific difference of a person being impregnated by any different than being incest, or so. Therefore, in order to get more people to vote for the bill, political considerations, we put this in, which I think on its face makes it flawed.
Well, again, I think to your point, if you can help lead this General Assembly to a point where we recognize all children, I'd have you join me. I'd love to have you join me in leading that. I think the question is, in the balance of things, what's best? The question Representative Drenner raises, what's best?
I agree.
In this very imperfect world we live in.
Okay.
Thank you, Madam Chair.
Representative Henson, short and sweet.
Representative Setzler, I'm very concerned about forcing a woman to file a police report against a relative or a boyfriend with something, as someone earlier testified. It could be someone you know that got rough one night or something happened and you end up pregnant. A woman ends up pregnant, not you, of course. Because at that point you start investigations. We could continue on with that, but a police report, and here's my other question with the police report, filing it is one thing, but at one point a woman could say, I was raped. But does the investigation have to prove it in order for her to get an abortion? Do the police have to investigate before she gets an abortion to prove it really was a rape? I mean, when you're giving those as the only two exceptions.
Ma'am, I don't know which side of the question you're arguing on. If you're arguing to require a police investigation to be completed before the woman has an abortion, then let's debate. Is that what you're suggesting?
Well, I'm asking you if that's what's supposed to happen. I mean, you have no time frame in this. You're just saying, a police report must be filed. And I'm trying to find out at what point I file a police report. I get raped, I file a police report. Now, do I have to deal with the police and everything else, or can I go forward if I find out I'm...
Yes, you can. Under this bill, you file the police report. It's an official statement. Then you can go forward.
But
and if you want to raise the threshold, you want to make it more... If you want to put additional police requirements to complete investigations, if you want to pile that on, if you want to offer that as an amendment, then this committee, the chair would probably take it. What I sense, though, in respect to the lady, is you're trying to sharpshoot this and create sort of an attack on it without being a substantive recommendation. The question is, as we balance these things out, I don't believe if we do this, if there's a consensus in this body to provide a woman between heartbeat and 20 weeks an opportunity to have an abortion if she was raped, if you want to make it more rigorous and have more things have to happen, then you can offer that. But
I just was asking.
I'm trying to achieve a bipartisan consensus on this in a way that we can all be very proud of.
You keep talking about bipartisan, and I really wish you'd stop using the expression bipartisan, because it might not be a political bipartisan of Republican, Democrat, but there is a real partisan split between those who support your position and those that are supportive of my position. A real split there.
Okay, thank you, Representative Henson. Representative Newton, let's keep them short and sweet.
It'll be short and sweet. We got the bill sitting before us in this incredibly difficult situation we're talking about rape. Is there anything in this bill that would prohibit the morning after pill or Plan B?
Appreciate the question. Once again, I believe that we talked about my stance on life. This does not prohibit the morning after pill, and this would not prohibit any chemical abortion from the time the woman becomes pregnant, conception, until there's the presence of a fetal heartbeat. So that is, if there's a woman that was raped and she wanted to take Plan B as a
Would require no reporting of anything.
Require no reporting. That's
Okay.
completely available.
Thank
in
you.
this bill.
Okay. Representative Hutchinson.
Thank you, Madam Chair. I have a question about the same section for the exception of incest. Can you explain to me how a woman would prove she was a victim of incest?
Yeah, this is a question that was brought to me by some of our members. I think incest is still a crime in Georgia, and it's a very delicate, sensitive issue. I'd love to get the members' thoughts about whether this stays in or comes out. If the lady thinks this is a better law with incest coming out, then we can discuss that. It's a question that when it's raised, it can be a very, very delicate circumstance, and I had some people urge me to include it as part of trying to find the kind of balance we're trying to seek. But if the lady would like to take it out, I'd leave it to the wisdom of the committee to entertain that as an amendment.
I think taking it out would make things more difficult, I would think. Because if a woman is a victim of incest, the only way to definitively prove would be a DNA test. And that cannot be done before 6 weeks without a significant danger to the mother.
And again, it's my belief that if a woman it's to the point of filing a report, then that's they've crossed a legal threshold that makes sure it's not just a flippant statement, but they've crossed a legal. And if it gives rise to crossing a legal threshold, I think that's perhaps the right balance.
I'm sorry. Okay, Representative Sharper.
Thank you, Madam Chair. I would just want to go on record as saying that I think that the bill that we have here in front of us, that if those are the only exceptions, for abortion things, that we're going to have a lot of people in Georgia that are going to be investigated falsely and falsely accused, I believe, because there's no other out. So that's why, I say you looking to work with everybody. I think we need to table this so we can come up with something that would be better, for our citizens. I just want to go on the record that this bill is not ready to go forth to be voted on.
I'm sorry. Representative Bennett.
Madam Chair, and I'll be brief, and you may have already addressed this. I did have to step out for a moment. I apologize. Are there any provisions in this bill that covers a mother who may be diagnosed with cancer or any type of severe condition that may require some drugs or treatment that will endanger the embryo?
Thank the lady for the question. If I could direct your attention to lines 156 through 162 of the bill. If in the doctor's reasonable medical judgment, many think that gives doctors too much flexibility. We could debate that. I think we've been in the doctor's reasonable medical judgment. If they believe that the abortion is necessary to avert the death of the pregnant woman, if it's an ectopic pregnancy, if there was a pregnancy becoming pregnant, the child was lodged in her fallopian tubes, and that could lead to a death, then we allow for that as an exception. Likewise, if it were going to lead to an impairment of a major bodily function or organ failure, then that is provided for on lines 156 through 162. And again, I think it becomes a circumstance of making decision around lives, Some mothers may choose to risk it, but we do provide women that opportunity if their life's in jeopardy. They have that exception here.
Madam Chair, may just a follow-up, please, just briefly.
Okay.
So I'm
Yes.
imagining that if a woman knowingly has cancer or any other type of condition that requires some type of medical treatment, that it's already proven to be adversely impact their embryo, does the mother have to continue on until they find out that that has impacted or created an issue or problem with the infant or the fetus?
Again, I will say this. It's my belief there are circumstances where oncologists are able to treat women that have cancer that are pregnant without losing the child. But what we do provide here is if the child's if the presence of the woman being pregnant, presence of the child in her womb is going to lead to her death, we do give physicians an option to take the child's life in abortion if that's
That's a slippery slope and didn't quite answer my question, but I yield. That's okay. Thank you.
I'm trying to. I'm not sure I understand it, but
Representative Fry has not asked a question. Representative Mitchell, I'm going to skip you since you have. Representative Fry, you're the last question on this one.
Thank you, Madam Chair. I have 3 real quick ones.
Okay, go quickly.
Very quickly. How many women are pregnant at any given time in this state?
we have about 130,000 births a year in Georgia, plus or minus.
Okay. If you look at lines 131, 133, just trying to figure out exactly what that means, any stage of development. I'm not a doctor, you know that, you know.
Sure.
You know me. What's that earliest stage of development that's allowable under this legislation that gives rights to maybe a cluster of cells? Is that what we're doing here?
What we're doing here is if a woman finds that she's pregnant and has a medically confirmed pregnancy test, not from the drugstore, but medically confirmed, then we know that she's got a living, distinct human growing inside of her. And we recognize that. She immediately begins incurring healthcare costs. She's taking prenatal vitamins. She's going to the doctor more. Those things happen. So we recognize it as soon as she has a medically verified pregnancy.
Okay, but I want to point out that it does say any stage of development not medically verified as far as the legislation is concerned.
That's correct. And again, as you talk about, what we put in statute and what we leave to rulemaking, the medical verification of a pregnancy is nowhere in our statutes with respect to public benefits. That's in rulemaking about who can do that, under what circumstances. We're trying to provide just the appropriate amount of detail here.
Okay, one last question. In lines 289, 290, and 291, will there be instituted a standard behavior for any female who is pregnant with a heartbeat in order that they're not getting charged with a crime for a miscarriage for any activity that they may engage in? I think what this section does is turn our women in the population who are pregnant into literal incubators, where we sit them up in a certain spot for fear that if they go running, if they're biking, or 7 weeks pregnant, something goes wrong, can't they be held liable for a crime according to this legislation?
Thank you for the question. What this does is it moves the threshold for homicide. Homicide being a civil finding of it's a, as you think about a wrongful death case, if there's a homicide that leads to a death, that gives rise to like a wrongful death circumstance. Currently the standard is at quickening. And quickening is somewhere 15, 18 weeks, depending on the circumstances. And that's when the woman can feel the baby sort of kicking around. That goes back hundreds of years in the English common law tradition. When there was movement of the child inside and that could be recognized, that's when these full legal rights accrued from the civil perspective. That's our existing law today. What this does is it moves it from this sort of hard to define quickening standard, which isn't written in code, it's in case law, and defines it as when you've got the heartbeat, then those rights attach. It's sort of quickening 2.0. They couldn't see the heartbeat beating 200 years ago, 300 in the 18th century when this became the standard, and even earlier. It puts it in code that heartbeat is the threshold and not quickening. So it moves it from 15 weeks to somewhere in the 6 to 8 range, depending on the detection.
All right, we're going to go to, who had the last? Sessler's group. Who do you want to speak?
I think I just called for Mrs. Thank you. Rachel, if you'd let us. Ms. Heather Hobbs. Thank you.
Hello, everyone. My name is Heather Hobbs. I'm with Save the One. We are a global organization with over 600 plus women who've come to us who've conceived in rape. And all of those women who've come forward were also advised to abort by their doctors. They come to us specifically because we advertise and post, we're here for you. We want to talk to you. We want to help you. And I'd really encourage you to check out our organization. 3 of my 4 children, I've got 4 already, 3 of them were recommended for abortion. And as I've watched all of you today, I keep hearing about the cases of rape. And when I was 19 years old, my first child was conceived in rape. I was raised to be pro-choice. I thought I was pro-choice. I thought I was for women's rights. I thought it was reproductive health care. I had that child that I conceived from rape, whom my doctor told me to abort, and that it was a justifiable, ethical reason to abort. My second and third child, they were said to be a threat to my life. My son Tristan, who is now 5, I had late diagnosed gallstones and acute pancreatitis that caused me to go into sepsis repeatedly. They were blaming the pregnancy and said, you can just have another one. My third child, Gideon, at 24 and 25 weeks, he was diagnosed with meconium pseudocyst. They said he had 0% chance of survival and that he was a threat to my life. You can imagine as a mother, hearing this 3 separate occasions was very difficult. And by the time I had got to Gideon, I was very hurt and outraged. Each of these amazing 3 children has value. They are a person with value just like you or I. I want to speak on behalf of HB 481, maintaining, not discriminating against those who have been conceived in rape. Many people who are for abortion claim it's barbaric to force a woman who has conceived in rape to carry a child, the child of a rapist. But I am telling you today that my child is not the child of a rapist. She is a child of a rape survivor. And because of her, she offered me healing and hope and strength. Having an abortion would have been a second trauma to my body. Can you imagine a woman who has recently been raped, which is already a brutal and horrific thing, and now we have asked her, the doctor has advised her to have an abortion. And think about what an abortion entails. Think about what she is going to have to be awake and aware of this situation where they are going into a very sensitive, recently traumatized area of her body. Can you imagine the second trauma that would be? I find it horrific that we are, as a society, discriminating against babies and punishing them for another person's actions. If your biological father raped someone right now, and we sent the police to your home, they knocked on your door, they arrested you, and they gave you the death penalty. You got the death penalty for what another person did. Would that be fair? It wouldn't be. We would all be outraged. We would all be upset. And I am so disappointed and hurt to see children like my daughter or like my 2 sons that are exploited as being unworthy of life, that they are less than human. They don't matter. Do not exploit children like mine. Please, I beg of you. Don't advocate for these false beliefs that it is in some way helping women like me to have an abortion, to give them abortion, when it's only that trauma. Especially in cases of rape. Imagine enduring that dangerous, invasive procedure. Rapists, child molesters, and sex traffickers love abortion. It enables them to continue perpetrating again and again. Our network of women grieve at how continually we are saying that they're the exception, that they're devalued and they don't matter. We are sending the message to these people that they're not worthy of life or deserving to be here. Exceptions deny the right to life and deny equal protection. I know that you guys touched on the 14th Amendment. And I know that we discussed that no state shall deny a person equal protection of the laws, deprive a person, deprive a person of right to life without due process. I also wanted to take a moment because there was something that I believe it was Representative Mitchell said that I agreed with about the lack of scientific difference between a child conceived in rape and a child that's not. That really, really struck me. There is no difference. These are children. These are precious babies. So, I know that I'm running out of time here. I wanted to summarize by saying, I really hope to raise my children in a country that does not discriminate babies based upon race, gender, disability, or way of conception. I am urging you to please pass on HB 481 without exceptions so that we do not send the message to our people groups that their lives are worth less than anyone else. Thank you.
Representative Petrie, you had a question?
Yes, Madam Chair. I just wanted to say to the lady, we appreciate very much. We can tell how heartfelt this is to you. And to everyone, I just wanted to call, something just struck me as I was sitting here, because everybody here is passionate about this. And to both sides, I want to say this. You know, it struck me. We're talking about human beings. Recently on the Georgia coast, we sentenced a man to 21 months in jail for stealing turtle eggs, embryos of turtles. We sentenced that man to 21 months in jail. Today we're talking about, regardless of what side we're on, I saw that loud and clear as I was listening to it, we're talking about human beings. And so I appreciate that you're here and others are here and that we're having this conversation because it is an important discussion, and that's what I'm talking. It's an important discussion. Far more important than anything else we could be discussing today. So thank you for being here.
Thank you.
Okay. Representative Hutchinson, are you?
Thank you,
This is the
Madam
last
Chair.
question on this. We'll go.
I just wanted to commend the young lady for her story and for your organization and for the services that you provide. And I am so happy that you were able to have that choice to raise your children. But as a professional social worker for the last 20 plus years, I can tell you that you have skills that not everyone has. Not everyone has the coping skills that you have. Not everyone can handle the situation that you are in. That's why I'm glad that you had your choice And I'm glad that women have their choice, just in case they can't handle what you did. That's it. Thank you.
For clarification, so you're saying still that it's okay to kill an innocent human?
I don't think you need to ask that question.
Okay.
Thank you. It's the representatives. Thank you for your thing. And I do want to say, some of the people that have testified, we are terribly lacking in physicians to take care of women across this state. And regardless of which side you're on, I would like to say that when doctors tell, and as a healthcare professional with a husband who was a physician, when they tell women that they think it would be best to abort, they're doing it not out of malice, on their best of their medical knowledge. Do some people survive and have a healthy baby? Yes, they do. But there are other women, when they decide not to abort, who die because of septicemia and the things it's caused. So just want to make sure that we are not sending a message out across our state that we think all doctors, when they make such a recommendation, are doing it on a fact that they want somebody to have an abortion. They're doing it based on the best medical knowledge. And I, for one, appreciate every physician in this state. Are there some bad doctors? Yes, but 99% of them are there to help patients and do the very best they can. And that even includes you, Mark, who, so I'll include you, a person that's on my committee. So you're in that 99%. You're welcome. Just want to make that perfectly clear along this way. Okay, I'm going to, there's 5 minutes left on the against, and I had somebody that gave me a piece of paper to sign them up, and I didn't do it, so I'm going to take that time and give that time to John Walraven, or part of it, or whatever it is. I'm sorry, we've had a lot from our reps, but if and y'all have 13.5 minutes left.
Thanks,
Keeping
Madam
it.
Chair and members of the committee. I'm John Walraven. I represent Georgia's reproductive endocrinologists, and I want to thank all the physicians who decided to come up here today and testify. I'm going to scrap everything pretty much I was going to talk about tonight and just get to the point. First of all, I want to say that everybody in this room who's been here for any amount of time that has ever interacted with Ed Setzler know that the representative is coming to this debate with a pure heart and the best intentions, and only has really, just truthfully, the most pure reasons for doing what he's doing. And that is absolutely true. One thing I would like to just point out to the committee is that in the beginning of this calendar year, we had some atrocious abortion-related bills introduced in Virginia and New York. The very idea that we would be looking at trying in the United States to try to codify the ability to terminate a delivery is just, I mean, it's unspeakable. The hardest part to accept of that whole thing was the representative, the delegate rather, in Virginia, who opined that what the physician would be charged with doing would be to take that delivered child and keep it comfortable until it died. And Georgia prevented that from being able to happen with House Bill 954 a few years ago, because we made changes to that bill as it went through the process to where if a baby was going to be delivered with a fetal anomaly, like no heart, no lungs, no brain, the baby wasn't going to live, we allowed an exception to that abortion bill, to that abortion law of 20 weeks. 20 weeks, which was based on science. The notion that there was fetal pain, that there were pain receptors. It's debatable amongst people in this room, but there was a basis for the rule. That wise decision to prevent a baby within the borders of this state to be delivered and rest comfortably until they expired is being repealed in House Bill 481. We called it the medically futile pregnancy exception. Not that the pregnancy is futile, no life is futile, but there is only so much medicine can do. You can't put a brain in a baby, you can't rebuild lungs. As a physician testified on the Senate side in that debate, through tears, she's a neonatologist. She said, the good Lord just didn't make these babies where we could stick a trach down a 20-weeker's throat. Those babies in this bill will not be eligible for abortion. The mother will carry that dying fetus all the way to term and deliver it, if this bill becomes law, until it rests comfortably and expires. We're better than that. Please, this committee, I would ask you to reinstate the medically futile exception that Georgia has in its law. Georgia's reproductive endocrinologists come down here and testify on these things when facts are flawed and science can back up the flaws. And the sponsor of the bill said he wasn't going to spend much time on the findings. But the findings are very, very important. The findings are what tells the United States, it puts them on notice that we are about to violate our Constitution. And these are the grounds that we assert, Judge, Your Honor, ladies and gentlemen of the jury. So they, at a minimum, they have to be bulletproof. This is not a time to be political or to just fudge a little bit. This bill contains falsehoods that can be easily disproven just using a simple web search. There are claims about the human race that are simply untrue. You've heard testimony tonight from doctors. At 6 weeks after fertilization, a human being does not have a heart. A human being has tissues that are going to form a heart. It will happen sometime around 8 weeks, but it's not 6 weeks. The heart has not formed. What has not formed cannot beat. At line 45, there's a notion that a human being needs nourishment and a safe environment to grow to full adulthood. Anybody who's been a parent knows you need more than food and safety to become a full-grown adult. And it doesn't take a lawyer to make that argument to the judge. This bill seeks to amend the Georgia Constitution with a state statute. We are trying to find, with 91 votes in this House, that a fetus is worthy of recognition as a natural person. Can't change the Constitution with a general law. The bill states at line 80 that the presence of a fetal heartbeat has become the standard in establishing viability of pregnancy. That is absolutely false. A fetus without a brain or lungs or with a birth defect that has not been detected yet is not a viable pregnancy. And Dr. Newton, you're right, it's a sign of life. A heartbeat is a sign of life, but is not a dispositive, you're alive or you're dead kind of bright line like the bill wants you to believe.
You need to bring it to a close, Mr. Walden.
Yes, Madam Chair. It's been talked about the tax implications of this bill. This thing could have gone to Ways and Means and had a fiscal note. That's a major conflict to pass tax law in the findings. It's actually not even in the bill, it's in the findings. And there is a real exposure here to pregnant women who do have cancer and a patient who's going through in vitro fertilization. The standard of care is to have 6 or 7 embryos in the womb. Only 1, maybe 2 are going to implant. Is that going to be 5 abortions? And if it is, Thank you very much,
Thank
Madam
you.
Chair. Sorry for running over. I'll take any questions if you have any.
No, we're not
Thank
going to take any questions right now. I'm going to yield the time and give the other side an extra minute and a half because he ran over. Okay.
Thank you, Madam Chairman. My name is Jane Robbins. I wanted to address a narrow issue. Several speakers have made references to the claim that this bill is unconstitutional, suggesting that there's no point in passing it because it'll be struck down. I address my remarks narrowly to this claim. It is
And you are?
Jane Robbins.
No, a lawyer.
I am
or
a lawyer. I'm a lawyer. This session, I'm representing Concerned Women for America.
Okay.
It is certainly true that lawyers for big abortion have quickly filed lawsuits against the heartbeat bills that have been passed in other states. And the Supreme Court has not yet taken any of these cases to resolve the issue. But there are multiple reasons that this kind of statute should be considered constitutional, and reasons that could very well lead the Supreme Court to this conclusion. One reason, according to Supreme Court precedent, the states have a substantial interest in protecting unborn human life. The Eighth Circuit calls it a profound interest in protecting unborn human life. The second reason is that medical science tells us much more about this life now than was available to the courts in Roe and Casey. The most recent of those was 1992, and a lot has happened since then. This is one reason that it's constitutionally appropriate for issues of when unborn life should be protected to be resolved by the people of a state through their legislators and not by a court. This is what the Eighth Circuit said about this. Quote, "To substitute the court's own preference to that of the legislature is not, underline not, the proper role of the court." The third reason, removing this decision from a legislature means that elected representatives cannot take into consideration advances in medical science. So you have a decision that is there for decades and is completely outdated, such as Roe versus Wade. And number four, the facts of Roe versus Wade and the Casey decision have come out now, or the Roe and Doe versus Bolton, have come out now. We realize now what was going on in those cases. We realize that the plaintiffs in those cases actually flipped, and they were sorry they were ever involved. They were sorry they were dragooned into this, and they became very pro-life. We understand now what really happens with abortion is not that you've got the woman sitting with her kindly family physician. Usually, I'm sure that happens, but generally speaking, you have women going to abortion clinics and their baby will be killed by an abortionist that she has never seen before and she will never see again. There's not a relationship there. And we know much more now about the physical and psychological effects of abortion on women than they knew back in 1973. So finally, I would just emphasize a federalism point. I helped write a book about this, so I may as well put it in. As Abraham Lincoln noted, the founders never intended that all important policies that govern our lives should be made by 9 unelected men and women who wear robes. By passing this bill, Georgia can join multiple other states that are reclaiming their constitutional autonomy in this area. Courts, including the Supreme Court, do not act in a vacuum. The justices and other judges are aware of what's going on in the country. They see what's happening in various states. They see what laws states are passing. So I urge you to let Georgia join the other states that have made a bold move to say that under the Constitution, this is our role, it is not yours. The 11th Circuit and other courts might very well come to that conclusion. Justice Roberts said once that the states need to start acting like the sovereign entities that they are, and I think this is a great opportunity to do that. Thank you.
But I have one question, because in researching this, and it has been a concern of mine, so far, all of the states that have passed a bill with, lower times, all those have been, excuse me, Representative, I was trying to answer a question, okay, have struck down so far the ones passed by the states?
Most of the cases are still pending. The only
Well, they're
the
going
only,
up, but on the first
Yes.
level, they have
On-
been struck down.
On the first level, because district court, the only district courts that have considered it so far have said, well, we hate it, but we're bound by Roe versus Wade and by Casey. What we're saying is that this question is a novel question. The Supreme Court has never considered this. And the 11th Circuit might certainly say, we think that this is constitutional, and then it goes up to the Supreme Court and they decide.
Wait a minute, when you're saying that they haven't, it's novel, what's novel about ours that's so different from the others? I mean, I'm just trying to understand.
It would be a novel question in Supreme Court jurisprudence. The Supreme Court has not ruled on whether a human life with a heartbeat is protectable.
Okay, but any of those other cases, if they got there before our case, would be a chance for them to rule on that too. Correct?
Well,
I mean, that's what I'm asking.
It would be, although it would be great if Georgia, if all the cases were considered together when they get there.
Okay, no, I was just trying to clarify that. Okay.
And also, Madam Chair, you know, when you think about this bill, there are questions we put before the court of the humanity of the child in the womb that's outside of the abortion context. You know, in the Roe decision, we're, as we do often in the judiciary committees, when a court ruling comes down, we respond to that with legislation. Representative Sains had the bill with our applied consent notice. The way this has been structured is following the prescription of our courts. So we believe we are putting a different thing before the courts than exactly how the other states did, and I think that's an important distinction.
Okay, thank you. Okay, you have 11 minutes. You can use it, or you can have somebody else speak.
Madam Chair, we do have more speakers. If it's the pleasure of the committee to act on this, I would just ask the chair lady how she'd like to act.
Watts? Okay, I think, who? Lott. Okay, I think Representative, I would like to use that time since it's getting late, and I am trying to give both sides a fair hearing. I think there may be amendments made. You know that, and I want to make sure that everybody on the committee has had their say. We may be here a while. Thank you.
And if it pleases the chair, Madam Chair, the reason the substitute was brought was the expectation was to bring a bill that accommodated concerns that were brought to me. So I would, would just ask members to consider that as we consider amendments.
Okay. But it didn't include all of the concerns that were brought to you, if I understand correct. Some.
Madam Chair, the substantial concerns brought to me are addressed in the substitute.
Okay.
Yes, ma'am.
All right, Representative Lott, do you have?
Just at the appropriate time, Madam Chair, I'd make a motion.
Okay, I'll take it now.
I make a motion to pass.
Okay, I have a motion, do pass. Wait a minute, I have a motion and a second to do pass. All right, now is the time for discussion and amendments. Representative Mitchell.
Madam Chair, I think the last several speakers have been very, very compelling. I think that what has been mentioned is a terrible, and I know it's no fault of the author.
Wait a minute. Representative Donahoe, have you become the official photographer? We need to smile when you're putting your camera up there?
Yeah,
I mean, I've just gotten tickled. Every time I look up, he's got his camera up. I just wondered if you've become the official photographer of this. Okay. Then your legislative salary?
I am.
Okay, I'm sorry, Representative Mitchell. Go ahead.
Okay. The terrible contradictory juxtaposition that we place women in, and when we think about it, what we're saying with line 164 through 166 is that if a woman makes the conscious choice to become pregnant, or an act that causes a pregnancy, she cannot have an abortion. But if some man abuses her or takes advantage of her, then she would be allowed to have an abortion. And for the other reasons that was just put when we talk about the medically fetal exception, Madam Chair, I'm going to move that we table this bill so that we can further perfect it and bring forth the kind of legislation that I know the author would rather have.
posture on that. We already have a motion to move.
Table takes precedent.
To
Table does take.
Okay, I'm going to recognize that motion. All right, do you have a second? Okay. Can we forego discussion because we know what it is unless there's somebody's passionate? Okay,
So
everyone,
his motion was a motion to table.
yes.
I would oppose that motion, Madam Chair.
Okay, well, I just assumed that, but okay, that you made it. I'm sorry, it's not good to assume anything, but anyway. All right, everyone in favor of tabling the motion, raise your hand. Okay, everyone opposed to tabling the motion?
Jimmy.
Okay, the motion fails. Sorry. Now, right, we are in the posture, because I feel like people have amendments, all right? And rather than discussion for the sake of time, does anybody have an amendment they'd like to make? Representative Beverly, is that your mic that's on?
Yes, it is, Madam
Okay.
Chair.
And you have an amendment? that
Yeah,
you-
I have several amendments, and I'd like to draw your attention to, if the gentleman yields, if we first go to line 11, that we strike line 11 and insert in lieu thereof the following, starting with perform abortions to determine the existence of insert the word functioning human heart. So the amendment would say, insert the word functioning.
We have
Human
an-
heart before performing. And to
Heart
continue.
or heartbeat?
Heartbeat.
Okay, we have an amendment. Do I hear a second on the amendment? Okay. Any discussion on that amendment before we vote? Okay, so.
I object, Madam Chair.
You object.
Okay. Yes, Representative Newton?
Yes, I would question the motion, what's detectable on ultrasound, which is how this bill approaches determining it, are routinely reported as the initials FHT, fetal heart tones. It's the same up until 40 weeks gestation. It's always reported the same. It's a very accepted definition. It's clearly visible of functioning. Obviously, the cells are smaller than a functioning one at 40 weeks or at 2 weeks post, but I would just oppose the amendment for that reason.
Okay.
It's a clear definition right now under fetal heart tones medically when the heart is beating.
Okay.
So, because,
Yes.
Madam Chair, because he
All right.
addressed, can I address the concern that I have?
Yes.
And that is that I understand, doctor, that they are a collection of cells within the cavity of the heart, within that space. But as we've heard expert testimony today, it is not a functioning heart at that particular time. You're picking up the tones, the intonation of a flow that's going through that particular group of cells. And so functioning determines a different level, a different quality, or different criteria for saying what a heartbeat is.
Well, Representative, I think that wouldn't the correct, if you'd like to correct your amendment, I think it would be of a functioning heart
Yes.
instead of a heartbeat.
Thank
Would you like to correct it to that?
Yes.
Would
I
be
accept
more
it. Yes.
technically correct, I think, what you're
That's
trying
fair
to get
enough.
at.
Yes, ma'am.
Okay, so the amendment would be the existence of a functioning human heart. All right, we've had discussion. Everyone in favor of the amendment, raise your hand.
Raise your hand, David.
Everyone,
Raise your hand.
okay, everyone opposed? Yeah, I think it's opposed. Okay. That amendment fails.
Okay. For the sake of time, most of mine will go along the same lines, and so I'll just waive the rest of my amendments. And as long as we have a roll call vote, I certainly would appreciate that.
Right. Okay. You mean by name? Okay, all right. Okay. Pardon? Okay. Sorry. All right. Other amendments? So I would like to make one as chair. Excuse me, John, can you come up again and tell me? I'd like to have the one that you mentioned that was left out.
Madam Chair, I believe you would be referring to the medically futile pregnancy exception that is in existing code.
Yes.
Then, Betsy, I would ask for your counsel on this as well. Right, there's several places, and I think
If you look on 153,
it'd be from the word unless on 153 through the number 1 on 154. Would that be the first one?
all right, so it could be in, all right. And I will tell the committee, and, you know, I realize the difference. And it was the discussion when we passed it the last time. Some women certainly have the ability and the stamina and the emotional stability to carry a child that has a brain, anencephalic, thank you, I'm forgetting that. The brain looks like it's been cut in half. It's sliced off at the back of the head. There's no skull around it. And the brain, what little bit there is, hangs out in a sac. That is incompatible with life. And some women have the stability and the, like saying, the emotional stability to carry that baby to term. To go to the grocery store and they're 6 months pregnant and have somebody say, oh, you know, what is it? Is it a boy or a girl? And, you know, what do they say? Yeah, it's a boy, but it has a brain that's hanging out in the sack and not going to function. There are others that doing that would literally put them under psychiatric care. If a child has no kidneys, you know, they cannot live. They live because the mother is carrying them and the functions are that way. So that is what that exemption was put in. I would ask this committee to trust me enough. I'm just a member on this right now, asking you to understand what that can do to women, because I have to catch myself when somebody's far along, it's 7 or 8 months, asking, you know, whether it's a boy or a girl and how they're doing, and that's not always a good type of question to ask when you don't really know the circumstances. So what I would ask that we would make that amendment to do and add that one exception in the correct places and let Betsy put it throughout where it needed to be added. So, and who's that? Representative Newton.
Thank you, Madam Chair. I know that the goal is a compassionate goal. Is that, I don't know if Betsy could tell us, we don't have the language, 31-9B-1, which is the definition of medically futile. With regard to one of the earlier testimonies, there was a discussion about disability that might follow birth. And I think we heard from a couple of people that, is medically futile a very tight definition? I didn't know if we had the wording incompatible with life would allow. Is that what it essentially is?
It did not include disabilities.
Madam Chair, could I get 2 more minutes of the time we didn't expend to speak to this amendment by
Sure.
chance? I'd like to yield my time to Ms. Rachel Guy. She was one of our.
You can speak to the
Speak,
amendment.
okay.
If you want to speak to the amendment.
Thank you, Madam Chair.
It's not for disabled children or anything like that. We made sure, and just to make sure and clear last time, or for Down syndrome or anything like that. It was incompatibility with life. No.
Say that I believe you can't make the statement of being incompatible with life when you're alive in the womb. If we are claiming that we're incompatible with life based on birth, and so therefore the child dies after birth, we are as alive inside the womb as we are outside. And so to claim that we are incompatible with life inside the womb is a fallacy, is not true, because we are alive in the womb, and children deserve the value and the right not only of life, but of the continuation of life.
I know that you're very passionate about this, but I would disagree with you in that a child like this is living not because of their own body function, but because of their mother's body function. And they're really not, but I'm not going to get into it with you. What? Medically futile means that in reasonable medical judgment, the unborn child has a profound and immediate congenital and chromosomal abnormality that is incompatible with sustaining life after birth.
And Madam Chair, I would appreciate your consideration.
Right there.
I would say there were 3 doctors that told her parents that she was.
Right. Doctors can make mistakes. Okay. Representative Sharper.
Thank you, Chair. I have possibly one amendment.
Wait a minute. We haven't voted on the one I proposed.
Okay, go ahead.
Okay. I would propose that amendment that we put that into and make that an exception. Do I have a second on the amendment? Thank you. Thank you. We have a second. And the amendment would make and include incompatible, what is it again? That's it. Medical futile. It would restore the medical futile exception. Any further discussion? If not, everyone in favor of the amendment, raise your hand. Thank you. Anyone opposed? Do likewise. Thank you to the committee for that amendment. Okay, going forward. Representative Sharper.
Thank you, Chairman. Just for the record, maybe get struck down or not, but if we can look at, by striking on line 154, if we can say by striking a human heartbeat and inserting a functioning human heart, and the pregnant woman wants to carry the baby to term or continue the pregnancy.
154. One more time. One more time.
Right here, okay, on line 154, by striking a human heartbeat and inserting a functioning human heart and the pregnant woman wants to carry the baby to term or continue the pregnancy.
You know, I think we have an objection to that.
Okay.
Okay. I will take a vote on it. All right. Everyone in favor of the amendment as Representative Sharper proposed, show of hands. Everyone in favor? Everyone opposed?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 16. Still opposed.
Other amendments? Representative Bennett? Oh, Representative Schofield.
Thank you, Madam Chair. So I'd just like to make an amendment on line 164 through 166 to remove the court, the official police reporting. We talked a lot about it. You seemed open earlier, so I'd like to make a motion to remove that.
Okay, what would the amendment, how would it read?
I'd like to strike that whole section,
Which one?
164 through 166.
Okay, the amendment is to strike 164, line 164 to 166. Do we have discussion on that amendment? No. All right.
Madam Chair,
No, go ahead.
it's a policy question. I don't think it's accomplishing exactly what the lady's asking for. That policy question would make it such that there's no rape or incest exception, which I think I'd be friendly to if the committee could move that way. But it would make the ability to have an exception for rape or incest would be removed. It's not just you'd be removing the rape and incest exception altogether.
Okay, well, maybe that's not what I got.
Okay.
No, I don't think.
Okay, no,
let's
strike that.
Okay, I would accept that as a friendly amendment.
No, that's not.
Okay.
You withdraw the amendment.
That one. Well, no,
Thank you for that clarification, Representative Setzler.
Go for it.
Okay.
Madam Chair, I would go with that exception.
I am not gonna,
Let's.
Because I think what it would do.
I'm not gonna recognize you for that.
Madam Chair.
What?
Madam Chair, I call the question.
Okay. All right, I've got to call the question and, okay. Everybody in favor of calling the question, raise your hand. Okay. All right. Everyone opposed? Okay. At this point, I've tried to give everybody and every side the ability. As you can see, this is a question that's very divisive, and it's very close. And I have tried to listen to both sides. But I think, obviously, because of the way things go, I think we're down to the decision. We know how the amendments are going to go. It's a late hour, and I am going to make the decision to go ahead and call the question and move with it as chairman. Okay. Okay.
You have to have a 2/3 vote to call a question in the middle of a debate.
You know what?
And by the virtue of it being 16-14, that would be out of order.
Representative, I do not know, and I will ask Betsy. I'm afraid I've never been asked that one and do not remember it from our rule. Betsy's, pardon? Well, I mean, we've still on the amendments. Would this be under Robert's Rules of Order? It's under Robert's Rules of Order. And the House rules.
I'm not sure that's.
I'm-
Madam Chair, I would say that at some point, if amendments were dragging on in a way that was not substantive to the underlying subject matter, I think you could call some non-germane and call the question. I do think there's a point of that.
No.
So, I don't think people could keep debate going on indefinitely.
Yeah, right. And I really don't think that's what they were trying to do. I mean, I'm trying to be as fair about this as I can possibly be.
Thank you. Thank you.
Representative Setzler.
I asked Legislative Council, that does not rule number 12. Betsy, give her the opportunity to be able to rule how she chooses without a 2/3 vote. You could call it non-germane.
Okay. All right. Can I ask from the side that's doing the amendments, how many more amendments did you have? How many?
10.
Does require, Betsy says it requires 2/3. from what she can tell. So we're going to honor Betsy as our legal counsel, and I will honor her decision. Thank you. Thank you very much,
Parliamentary
Betsy.
inquiry, Madam Chair. I asked the Legislative Council to reference the last sentence on rule number 12. Reserves the right not to entertain any amendment, substitution, or motion. Doesn't that give her the right not to recognize Representative Beverly's motion? I'm sorry? I'm looking at the committee rules. Yes,
Okay, you know, the House rules override.
they do not.
No.
Okay. Okay. Let's just move this back. This is a divisive issue. You know, I am willing to spend the time to let both sides have their say. So I'm going to move forward with this and let them have their say. It doesn't need to be any more divisive than it already is. People are very divided on this. And everybody is entitled to how they believe. This is the legislative process. So, I'm sorry if you have dinner plans, if you're supposed to go let your dog out like mine, whatever the reason is, we are going to do this. If I think that a suggestion is non-germane or ridiculous, I will rule not to recognize it. But given reasonable amendments put forward, we will go through the process. All right. Representative Schofield. The committee will please pay attention to the proposed rules or amendments as they come forward. The quicker we move through them,
Yes.
the quicker we can get out of here.
And everybody should have a copy of them, actually. Thank you, Madam Chair. So, lines 12 through 16, and inserting in lieu of thereof the following: abortion to provide for the reporting of certain information by physicians, to provide for legislative findings, to provide for related matters, and then there's a 2. So we want to insert in lieu thereof of the following by striking line 11 and inserting in lieu of the following thereof. Thereof of the following.
Jack.
So you're just striking line 11?
Yes.
So how would it read?
Okay. Which I should put my glasses to. All right. It will read. All right. Performing abortions to determine the existence of a functioning human heart before performing. Okay, we want to take out inserting by striking line 11. We want to take that line out. And inserting in lieu of the following: performing abortions to determine the existence of a functioning human heart before performing an. So I may have to take a minute because this is not. Beverly, help me out here.
Madam Chair, we already voted on that.
Yeah.
Right.
Okay.
Okay.
Beverly, can you help me out?
We,
No, go to the okay.
to the next one.
All right, so the next one would be, and I apologize, by striking line 66 through 68 and inserting in lieu thereof of the following, just on 9, just reserved, we're adding the word reserved. 66, you can help me on 9. Okay. You see it?
All right, how would it read?
Okay. This is what you, okay. Where are we? Hang on. 66 through 68. Just pause. Through 68. and
Just
insert-
strike in total, 66 through 68?
Yes.
And lieu thereof wants to put a.
Just words, just reserved.
Just wants to put reserved.
Yes.
Okay.
Okay.
All right, amendment is to strike all of lines 66 and 68 and put reserved. That is the proposed amendment.
Right.
Anyone in favor of that amendment, raise your hand. All opposed, raise your hand.
We gonna go through this all day.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17.
All right, the next one, okay.
Madam Chair?
Yes?
She's getting her amendments together. I have a friendly amendment with the author.
All right. What is the friendly
My
amendment?
friendly amendment that the author said he would approve is if we would eliminate in total lines 164 through 166.
I am not going to recognize you for that amendment. Sorry. Okay. Representative Hutchinson, do you have an amendment?
I do.
All right, Representative Hutchinson, what's your amendment?
On line 3, where it says that a child at any stage of development who is carried in the room instead of shall be, may.
Oh, may be included, okay. The amendment is on line 3, that at the end,
Madam Chair, that's a caption of the bill, isn't it?
That's the caption.
You can't amend the caption, can you?
Should be, have a corresponding change to the bill.
okay. And it's, okay.
Yeah, it would be line 3 and line 27.
Is line what? I'm sorry.
I think in different places.
27.
All right. Okay, line 3 and 129. Okay, the amendment. Okay, guys, can we have everybody quiet in the room? And that includes legislators, unless they're conferring with each other. Okay, so I can hear. We have an amendment. Thank you for that. We have an amendment. On the end of line 3, it would say, instead of shall, the last two words are shall be, and it would say may be, and it would need to be changed on one line.
On 132.
On 132,
Yeah.
Betsy, read how it would be.
So it would say, unless otherwise provided by law, any natural person, including an unborn child at any stage of development who is carried in the womb, may be included in state population-based determination.
Okay, what it would be, to explain that amendment, would be that it wouldn't be a must that you had to claim an unborn child in a census from the state or state statistics.
Madam Chair, I will say, it's written unless otherwise provided by law. The circumstances where that's not appropriate, that law already provides for how it's done, the census and otherwise, would be those exceptions. So that's already addressed in this. The shall is only in those circumstances where it's complete, the state has the
Not
ability
done
to do
it,
that.
I
Yeah,
know.
that's right.
So that is still up for consideration. Everyone in the favor of that amendment, raise your hand. Representative Henson.
Are we talking about this being included in the census?
Yes.
Because then would we be the only state in the nation counting unborn embryos?
Madam Chair, that's the lady's question. That's why it says unless otherwise provided by law.
But that's what I'm asking, so
I'm gonna
therefore,
answer your
we'd have
question.
a higher count than we should actually have.
No, I'm going to answer your question. This does not apply to the U.S. Census data. The states provide all kind of data to the U.S. Census Bureau, a subset of which they use for their census numbers. This would not affect our census numbers at all because our census numbers are driven by the U.S. Census Bureau's standards. In circumstances when we use the U.S. Census Bureau standards and apply those to Georgia voting and a whole number of other circumstances, this wouldn't change that at all. This just would be extra data we collect as a state, and in circumstances that are not provided and prescribed by other color of law, we would use this for those circumstances only.
All right, so we've had that explanation. Everybody in favor of the amendment, raise your hand. Everyone opposed, do likewise. Thanks.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16.
Thank you. All right. You have the amendment? Is it ready to go? I mean, we are not going to be able to sit here and come up with amendments all night. Representative Jones.
Yes, thank you, Madam Chair. On line 131, by striking the word shall and inserting the word may.
We just did that one.
We just did.
You just did that one?
We just did that.
Oh, I'm sorry.
And it failed.
Okay.
And one of the reasons I'm allowing this, so the committee knows, is because we were late in saying we were going to hear this bill, and people really didn't have time to make amendments, and I am trying to be as fair to both sides as I possibly can be, because both sides of our aisle, Democrat or Republican, whether you agree with them on this issue or not, deserve on this very important issue to have their say and to try to make their amendments, and then it's up to the committee to deal with those amendments as they wish. All right. Does anybody else have an amendment? Okay. Representative Fry.
Thank you, Madam Chair. Lines 260. This would be an amendment for the points 1, 2, and 3. I don't know how to quickly articulate it, but I'd like for the committee to consider striking or adding the presence of a functioning human heart in place of the presence of a human heartbeat on line 260, as well as line 263, as well as line 267.
I think we did it on one particular place, right? So this is a new amendment. We only did it for one particular place at the last time. So the amendment is up again, would be on lines 260, 263, and 267 to replace heartbeat, insert with a functioning heart. Okay. Everyone in favor of this amendment, raise your hand. Everyone opposed?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16.
The amendment fails. Are there any other amendments before we vote on the bill? Okay. We have a motion and a second to move the substitute to House Bill 481 as amended with the one amendment that I made. That is the question. We have asked for a roll call vote. Do you still want that, Representative? I don't know why. You just get the pictures from Representative Donahoe, and you'll be able to tell, is your camera ready, sir? He's not listening to me. Never mind. I'm trying. Everybody smile for the camera. So, no, what? No, I'm gonna do it. Okay. All right. We're gonna do the roll call. We're starting now. We're moving on the motion to here again to pass for the passage of the substitute to House Bill 481 as amended. Start the roll call. You want to do it?
Newton.
Yes.
Barr.
Yes.
Reinders.
Yes.
Beverly.
No.
Bennett.
No.
Chiukas. Dempsey. Douglas.
Nope.
Drenner.
No.
Fry.
No.
Gaines.
Yes.
Gordon.
No.
Hatchett.
Yes.
Hawkins.
Yes.
Henson.
No.
Hogan.
Yes.
Howard.
No.
Hutchinson.
No.
Jaspers.
Yes.
Jones.
No.
Kelly.
Yes.
LaHood.
Yes.
Lott.
Yes.
Mathiak.
Yes.
Mitchell.
No.
Parsons. Petrie.
Yeah.
Pruitt.
Yes.
Schofield.
No.
Sharper.
No.
Silcox. Stevens. Stevens is absent. Stevenson.
No.
Tankersley.
Yes.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Noes are 14. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Yeas are 17.
The substitute to House Bill 481 as amended passes. Don't everybody leave. We have to go back to the Tanner bill. So thank you for everybody's patience with us and letting us try to give everybody, say to this. Can we move back to Representative Tanner's bill?
Thank you, Madam Chair.
Wait a minute. Let me talk to you at this point.
Yeah, if we're gonna stay longer, Jody, Governor Kemp.
Representative Lott. What? Okay, wait a minute. Okay, wait just a second. Okay, Representative Lott, you have a motion?
Madam Chair, I make a motion to table House Bill 546 that was on for today.
Okay, and
Can I ask a question, Madam Chair?
yes, Representative Kelly, you have a question?
Madam Chair, I'd just like to ask the governor's floor leader, by tabling this bill, that this means the governor's gonna support the measure that this House just passed.
It is my understanding that the governor of the state of Georgia is very much and unapologetically pro-life, and this bill is certainly that.
The one that just passed?
The one that just passed.
Okay. Okay. Representative Hawkins, did you have a question for Representative Lott?
Not really, just a statement, quick statement.
Go ahead.
I would like to thank the committee and the people in the audience. I have a grandson that's probably 6 weeks old now, and he's trying to cling to life, and we're making a decision to let 6-week-old children live. Thank you.
Representative Beverly? You
Yes,
have a
on the
question
general-
for- Shh. Representative Beverly has a question for Representative
Well,
Lott.
no, on the general lady's
Oh.
motion, I want to go ahead and second that to table 546.
Oh, good.
4-2. Yes, okay. I wanted to second the table 546.
Okay, we have a motion and a second to table 546. Is there any further discussion on that? All right, everybody in favor of tabling 546? So that, can I have just ayes this time? Can everybody in favor say aye? Aye. Anyone opposed? Okay, the ayes have it, the bill is tabled. Okay, back to House Bill 514, Representative Tanner's bill. Will you please go to the page that was left out? And please look. Do I have a copy of it? I think so. Okay, we need to have order. Excuse me. Excuse me. Everybody that's in the room, as you leave, please cease your discussions. We are still in session, and we need to be able to hear so we can finish our work. Thank you very much. There are people that are very interested in this bill. Okay, everybody has page 2. That's what was missing. And you will see that basically it talks about the people that are going to be appointed, or types of individuals, and where their backgrounds, where they come from, and represent, that are going to be on the commission. Do I have any questions about that? Are there any questions? Okay. Representative Beverly.
Appropriate time, make a motion to pass.
I've got one question. I'll come back to you for that. Representative Hogan.
I'd like to second that whenever appropriate time.
Well, I have no other red buttons at this point, so why don't we, Beverly, Representative Beverly?
Motion to pass.
You have a motion on a due pass to House Bill 514, and a second from Representative Hogan. Do I have any further discussion? Okay, I have, hearing no further discussion. Everyone in the favor of the passage of the substitute to House Bill 514, say aye. Aye. Anyone opposed, no. The ayes have it. Thank you very much. I appreciate the committee, and I appreciate everybody that was waiting to hear the final on that bill. Thank you for your patience.